Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with IT&D. Be healthy. Be informed with IT&D.
Now is not the time for us versus them.
Panogita moru purita nonda kantai mantunat nyagi toru iluga.
GMH Administrator Lillian.
Honra para y gloria abiba islasen para.
University of Guam Dean of Nursing Margaret.
Honra para y gloria abiba islasen para.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Contrai peligro na fansafuham dus protegis languam.
Out in the public, where all are more exposed.
585 have tested positive.
Protegis languam. You better not complain, boy. Get in trouble with the mountain. Let the midnight special shine a light on me. Let the midnight special shine a light on me. Let the midnight special shine a light on me. Let the midnight special shine
there you go, Joe McCarroll. Ain't no food up on the table because we didn't get our stimulus yet. Hey, but it looks like help is on the way. Good morning, Guam. Good morning, 620. It is the KUAM News Takeover, Guam's favorite I-94 containing COVID. It's Wednesday, the 6th day of May, as we're getting ready to evict the coronavirus from our island on Monday, May 11th. You thought there was no more evictions, but there's one more eviction going down. We're slated to begin gradual reopenings. We're going to have information on that this morning for you, and a whole lot of new news and info for you as the governor. I got to say, her, what do you call it, performance? I don't know you call it performance. But the press conference yesterday was a welcome change from the way the press conferences have been going. I noticed a huge difference in our governor, Governor Lulian Guerrero. Honest assessment, Bree, it seemed like there was a big burden lifted.
Why do you say that?
Because, in questioning her and asking her questions about aid and assistance, I mean, it was clear that it was triggering her and she was very frustrated. And I think with this new plan, they came out to get that federal COVID cash into the hands of local residents while they wait for the stimulus checks, while they wait for the unemployment program to kick in. I think, it lifted that burden off. It kind of took the pressure off her. And so she sat in yesterday at that press conference and answered pretty much every single question that the media had to ask. And, this is their version of a restart. I mean, we'll find out if it's going to hold true to form. But, that press conference last Thursday, it was a big call out, and I think a huge wake-up call. And the, chain of events with Tony Babalta resigning and the legislature calling for transparency, everybody calling for transparency. I think that this was the administration saying, okay, we're going to answer all your questions. They had a bunch of initiatives they unveiled, or a couple, I think there was 3. There was a green garden one or something.
No, I think Lester was like, hey, did you want to talk about that?
Yeah, the governor's like, not really, but okay, I can tell you what it's called. And then there was also a Salapi Ajudanti Itautau Guam or something, some kind of program there to...
Stop, please stop.
Okay, sorry. It's 6:21. Hey, and the show is proudly brought to you by Calvo Enterprises, Ambrose Inc., and, of course, IT&E. And also, we've got some great sponsors on our 671 banking.
Yes, Bank of Guam and Coast 360.
And there are so many ways to catch this multimedia broadcast extravaganza right here on the radio. So great to be back. Thank you, Andy Wheeler and I-94 family, for allowing us to use this studio for the Containing COVID radio show. It's 93.9, Guam's favorite. And also streaming on KUAM.com and the KUAM News app. There's an audio feed on Docomo Channel 10. And at 8 a.m., we jump over to KUAM TV 11, where we are the morning show of choice at Hotel Quarantine at the Pacific Star. Yes, it is true. They watch us, Bree. And so, last but definitely not least, huge shout out to our Facebook Live audience at our KUAM News Facebook page. You guys are the best. Thank you so much for your support, watching, questions, comments, sharing the show. Really appreciate it so much. It's 6:23, as we often do. Well, often I say always. That's what I mean. Do a deep dive into the day's COVID-19 headlines from the KUAM News team with the very latest. Good morning, Sabrina Salas-Matanani.
Half a day, everybody. Good morning. According to the latest from the Joint Information Center released at 11 o'clock last night on Tuesday, 70 individuals were tested and 0 tested positive. This means that the number of confirmed cases of COVID-19 on Guam remains at 149. 7 who retested positive, tested positive after initially recovering. There are 124 recoveries and 5 deaths. During her press briefing on Tuesday, Governor Lulian Guerrero signed an executive order creating the Procurement Salapi Adzuran Itautau Disaster Relief Program, up to $1,200 in emergency assistance for as many as 18,000 local families could be sent out as early as Friday. The direct disaster aid program that will be paid for by $20 million from the more than $117 million in federal disaster assistance that the governor recently received as part of the CARES Act. Public Health will distribute the money to those who already qualify for programs like SNAP or Medicaid. Those who are within a certain threshold of the national poverty level can also qualify. For example, a household of 5 that makes no more than $4,400 a month. You can check the Public Health website for the chart and have until May 14th to apply. The governor also said she expects to reopen certain businesses by May 11th. Public Health will be releasing an advisory shortly for which industries will be allowed to reopen, and businesses within those industries will have to agree to certain health and safety guidelines. The governor also announced plans for $20 million in direct grants for business interruption losses. GITA is coming up with guidelines for which businesses can qualify. An announcement about that will also be made soon. The governor, meanwhile, says she understands the public is suffering and angry, and, well, she is too.
Do you feel you waited too long and maybe underestimated the level of financial anxiety that families were feeling and then the resulting anger? Did you think you waited too long for this?
I think it has been too long, but it's not because of my control. It is first federal control, and also we did not get the 117 million till about maybe a week ago or 2 weeks ago, and we could not use this money until we got the guidance and the advisory guidance on how we are to spend it. It's money, Nestor, that although it's under my authority, but it's not like I could just use it right away. And so the delay in pushing this money out is because we had to abide by federal guidelines and advice, and we didn't get it till I think about a week ago. And I just, for whatever it's worth, the other states also were just as frustrated and just as upset about the delay in trying to move this forward. So as soon as we got the advice, we started creating this program, and so now we have it out. I am very angry that our people had to wait this long, and I am very upset. And I have said this in the past, and I have done within my legal authority, within the regulations, within what I can humanly possibly do to try and push this out. So good things have happened this week. We've got the notice that our implementation plan for the economic impact recovery has been approved, and we're looking at pushing out that money as soon as we get it. And excuse me, we're probably going to be able to do that within the next 2 weeks. Additionally, we are also excited that our implementation plan for the pandemic unemployment program has been submitted, and they've received it. We also received the federal pandemic unemployment compensation agreement, and we are in discussions with the Department of Labor to get that program going. In the meantime, what we have done here is we have prepared our processes so that once we get the monies and once we get the okays and the approvals, we can push them out as soon as we can. So if it's anything that I can do, I will certainly do it with the best of my ability. I know people out there have been very upset. They have been very very scared. They it's like they have nowhere to go but to rely and wait for this. And again, the delay is something that I I have not in any way intended to do. It is certainly, like I said, I was very angry, upset, frustrated about the delay.
The governor, in the meantime, also signed Executive Order 20-2013, establishing the COVID-19 Pandemic Recovery Office, which will be responsible for working with FEMA and will be authorized to provide information, assurances, requests, or justifications on her behalf. The Recovery Office will also support the work of her recovery panel of advisors. Her order also implements transparency initiatives, including that all FOIA requests and responses related to the emergency to executive branch aligned agencies be submitted to the AG's office for posting on its website. Additionally, COVID expenditure reports will be submitted to the legislature to also post on its website. And finally, her executive order mandates that while the Guam Office of Public Accountability will conduct an audit of all spending under CARES funds, she will have a third party conduct a review. The governor, in the meantime, also apologized for what happened during last week's press conference.
Did you support the decision to censor the media and the action by your communications director, Janella, to press mute on our questions at last Thursday's press conference? And do you also plan to issue an apology at all for not answering the media, more so the people?
So let me just say, Adriana, that I give great respect for my director of communications and policy for being very forthright in apologizing. I also have great respect for the lieutenant governor and very forthright in apologizing. There was no intention of censorship at all. There was no intention of censorship. The fact that it was muted, it was muted because I know the guidelines were certain guidelines and it wasn't being followed. And that's, it is what it is, and people have apologized. And so I am going to be together with great respect, honesty, truth. Yes, I apologize for the mistake that happened. People make mistakes, government makes mistakes, but I am not ashamed to say we made a mistake, and so I apologize.
During her media briefing on Tuesday, KUAM asked the Magahaga if she thought the way her son-in-law and legal counsel Hagen handled procurement of hotels as quarantine isolation facilities would hold up to FEMA reimbursement standards. There are no contracts in place for those facilities, and FEMA has told KUAM they haven't received any paperwork on the procuring of hotels.
Do you still stand by your legal counsel's handling of this procurement, and do you believe it will stand up to federal scrutiny for reimbursement?
So I just want to also start off by saying this COVID crisis has been a very unprecedented event. This kind of emergency has never been experienced by anyone here, and also by anyone globally or even nationally. We have heard many messages from all over saying that this emergency is really a very serious kind of virus disease. And in saying that, when we got our 3 contact COVID positives, we quickly and expeditiously and aggressively put in measures to try and contain this virus. Why? Because we want to save the lives of our people and we want to contain this virus. So, in the issues of procurement, when I declared a public health emergency under the Public Health Act that was passed by the legislature, when I declared that, that gave me some powers to quickly act and to quickly make decisions and to quickly get the resources that I need in order to save the lives of our people. One of that is suspending rules and regulations, which also related and applied to procurement. So when we got these contact people and we were public health wanted to do a quarantine of all people coming in, we went forward and got the facilities. The way that we handled this procurement and the way that we used our emergency powers are within the law as stated. I truly, fully believe that the legal counsel and the legal team acted appropriately. They acted within the bounds of the law, and they acted quickly to help in helping the community contain this virus. So yes, I stand behind my legal counsel's actions.
Okay, and for a follow-up then, so the pandemic response plan assigns GHS and the Office of Civil Defense to handle procurement. So why did you feel it was necessary for your legal counsel to handle negotiations for quarantine isolation facilities? And what else is being negotiated on behalf of the government in response to COVID-19?
So I directed my legal counsel to quickly handle this situation. And yes, once contracts are signed, once agreements are made, they go through FEMA. And when we decided to go out forward, we decided that we wanted to work quickly, like I said, and we worked with GHRA. So FEMA is put in the loop. We give all the information to FEMA. And there were discussions with FEMA about this facility. There were discussions with the Homeland Security, so FEMA was aware of what we were doing.
The governor offered her version of events regarding the use of Public Health Director Linda DeNorcy's digital signature. DeNorcy said her electronic signature was used without her permission on documents relative to negotiations for the use of the Pacific Star Hotel for a GovGuam quarantine facility. The governor saying, quote, "It was a letter read over the telephone and her permission was asked and she gave and authorized her permission to that particular letter." Now, she did say to me she does not remember and she does not recall. Can be also plausible because as Linda is the director of public health, there's many things coming her way, many decisions she has to make. I can agree that she does not recall and she does not remember, end quote. KUAM spoke with DeNorcy late yesterday afternoon and she told us she stands by statements she made to the media. The legislature has voted to override the governor's veto of Senator Therese Terlahi's transparency bill. The bill was passed unanimously by lawmakers about 2 weeks ago. It now requires Adelup to provide a report to the legislature of all COVID-19 related expenses. The vote was 14-1, with only Senator Amanda Shelton voting against it. The governor in her veto message stated placing additional requirements on the use of these funds is an overreach of legislative authority. Here's more on what happened on session floor.
Landslide 15-0. What has changed since the veto by the governor? The only thing I can see is that this bill should have been passed because transparency has not been clear at all since the time we passed this as a body in our last session. In fact, the water even got more murkier with transparency, and the pool is even greener than ever before. I can't even see through it. I can't see my fingers anymore. What has changed is that I've been hearing about the media reports of so many different things that the people are frustrated and wondering, how can this all happen? It's questionable contracts. It's questionable transactions. From the 19th floor to the first floor and to the lobby, all the way down to the parking lot. It is our obligation to effectuate the checks and balances as a legislature body. It is not to point fingers. It is to be the eyes on the checkbook for the people of Guam and their taxpayers' money. And if things are run right, then we can stamp our approval on that. If things are run improperly, then we need to fix it. But we won't know unless we're transparent. And have we been seeing transparency? No. It's like a rainy day on Guam when I can't even see Two Lovers Point or 10.
Again, Senator Amanda Shelton was the only senator to vote against the override.
We must have faith that we will achieve this transparency. We as a body can take the reins of leadership by not overriding the veto. We can trust the administration also recognizes the need for transparency, and we must have faith that this will be achieved. Madam Speaker, I know that on Saturday, thousands of our people across the island felt what I was feeling, a renewed sense of faith and hope, seeing the love of God through the visit of Santa Maria Camalin throughout our villages. God, through the intercession of Our Lady, renewed our hope and faith. So let's build on this faith. Madam Speaker, overriding this veto is not an act of faith. It further strains how our branches will deal with each other. This is not anaphemalic. This is the antithesis of anaphemalic. It is the opposite of what we are called to do as island leaders.
It has been almost 3 weeks since all 15 members of this legislature united together to pass Bill 333 in a demand for increased transparency and accountability. This bill could have been signed on that day by the governor, but instead we are here weeks later to override the governor's veto and ensure that we receive timely reporting of expenditures, copies of agreements with the federal government, and swift implementation of these relief programs. Valuable time has been lost. In the governor's veto letter, she outlined several reasons the bill was vetoed. The first reason stated, and I quote, "A local statute commanding the executive branch to do what federal law already prescribes should not confuse these processes," unquote. I would argue that nothing in this bill confuses the administration's processes. What the bill does is requires the government of Guam to provide copies of agreements between government of Guam and the federal government. And while the administration is accountable to the federal government in relation to the stimulus funds, this administration and GovGuam agencies and employees are equally accountable to the people of Guam and
Bill 333. Again, the vote was 14-1 with Senator Amanda Shelton voting not to override the governor's veto. In other news, Guam Regional Medical City has begun conducting on-site drive-through testing for COVID-19. Now, this service is available to everyone, including GRMC patients and the public who will need a referral from their doctor to qualify to have the COVID-19 test performed at the hospital. The patient's primary doctor will be the one to contact GRMC's specialty clinic to ensure the necessary paperwork has been received via email, and if so, to book the testing appointment for their patient. Specialty clinic will contact the patient with the details of their appointment. The drive-through testing area is staged outside of GRMC's emergency department on the east side of the building. GRMC asks that patients arrive 10 minutes prior to their appointment. All test kits will be processed at their in-house lab. This test uses a real-time PCR method to detect COVID and confirm the diagnosis. There is a fee involved. Payments may be made by cash, check, or credit card payment. Manelu has been awarded a $151,000 CARES Act grant from the U.S. Department of the Interior. The money will be used to support Guam's local and migrant communities by providing culturally and linguistically appropriate information, assistance, and workshops during and after the pandemic through their Informed Island project. The project will work with Micronesian families to keep them informed, aware, and safe during the pandemic and help train and prepare those who have lost employment due to COVID-19 to re-enter the workforce. For more information about the services that Manetlu provides to communities on Guam, you can visit their website at manetlu.org. In news from the CNMI, Governor Ralph Torres' COVID-19 task force reports a presumptive positive case, which was identified as a result of community testing. This individual is now considered a person under investigation, or PUI. The PUI is a 17-year-old male who presented no symptoms. Further evaluation is being obtained from the U.S. Centers for Disease Control and Prevention to make a final case determination. The PUI is now isolated at Kanoa Resort, and contact investigation has started. In national news, the total number of coronavirus deaths in the U.S. is on track to hit 70,000. And now a new model, often cited by the White House, has doubled its projected death toll to more than 134,000 by August. This as at least 43 states have now partially reopened their economies. Michael George reports from New York City.
Following days of protest, beaches in 2 Orange County cities in California will partially open today.
I am so hopeful, and I just think that we need to stop dragging our feet and get this open.
California's governor has also announced some low-risk businesses like bookstores and florists can start curbside pickup on Friday. But Sutter County is defying.
Closed on Saturdays at this time. Coast 360 also has implemented several health and safety measures, including protective shields at all teller counters and service desks, floor distance markers and space line queues, hand sanitizers at service areas and entrances, hand washing station at the entrance of the MIT Member Center. Please note that you must wear a mask for entry, and while they plan to reopen, members are still encouraged to take advantage of alternate and electronic banking channels to continue to support stay-at-home efforts and limit in-person contact. That's your Banking 671 report, sponsored by Bank of Guam and Coast 360. And finally, in line with the One Team movement, Ambrose has donated more than 4,700 cans of water used by the USO to support USS Theodore Roosevelt sailors. There you go.
All right. Thank you, Sabrina Salas Mantanani, of course, with our COVID-19 headlines, 6:45, Wednesday, May 6th. So we're going to take a break and come back with the acting chief of staff for the governor of Guam, John Jr. Cabo, right here on KUAM News' takeover of Guam's favorite. It is containing COVID.
It's an institution that is GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Single close-up photo to birthdayclub@kuam.com. All submissions must be compliant with KUAM regulations and must be received 2 days prior, but no later than noon Chamorro Standard Time on the day of the birthday on weekdays, and noon on Friday if a weekend birthday. See KUAM.com for additional regulations.
The Birthday Club is presented by KUAM and Cold Stone Creamery and Yogurt Dessert Bar. Join KUAM News for the Containing COVID Takeover weekday mornings on I-94 FM and streaming on KUAM News Facebook to keep you informed and to help stop the spread in our community. Our live morning shows are brought to you by IT&E, Calvo Enterprises, and Ambrose Inc.
Driving round, windows down, warm breeze and a soulful sound. I got my mind made up about real.
Hey, thank you guys. Good morning. Keep your comments coming. There's a comment here from Joey Gutierrez. They're talking about the governor's addressing of the muting of the media. This is a good sign. Moving forward in a positive way, communication is very important so you can get back the people's trust. You are our first female governor, and I'm proud and honored of you. So please open our church, and things will start getting better for the people of Guam. Thanks. You're welcome. 6:50. Let's go to the phones now. Sir, we had a caller on the line who was asking about the different programs. Well, there's the big $300 program that Governor Liu unveiled yesterday. And sir, if you want to keep holding, we have the acting chief of staff of the governor of Guam, John Jr. Calvo, on. And John, good morning first of all, and thanks for calling.
Hi, John.
Hey, good morning, Bree. Good morning, Chris. Thanks for having me.
Of course. So, I mean, just first of all, what can you tell us the process of getting this the $300 aid? Because people are calling about that. So, can you just go through and walk us through that process, John?
Sure. So the Procurement Salat-Pinajuna Nitata is going to be run through the Department of Public Health and Social Services. So if you go to their website, to try to keep with the governor's social distancing executive orders, and just for everybody's safety, if you go to their website, there's some links there that will take you to the applications that need to be filled out in order to determine eligibility. And if you can't do that, then you're more than welcome to visit their office at the Castle Building. And then there's also, I'm sure there's going to be some applications available at the ITC building. But I believe it's the Castle Building that people should go to start accessing those applications. And then you can fill those out, submit them. There's a drop box there. And if you're going online, there's also an email address that's being used to submit those applications electronically. Public Health's team, their program under Tess Archangel, will review those applications, determine eligibility. I'm sure they'll get back to you, and then the checks will be pumped out. And so based on the initial reports, we should be able to start sending out some of that money, I think, by this Friday.
Where on their website exactly do we go to? Because I'm on the website, and I'm not sure where to click.
Okay. I'm going to be honest, I haven't visited the link actually, but I'm told that it's going to be posted on their website.
Is it a special application as different from the current SNAP and Medicaid MIP application?
You can use the current SNAP application.
Okay. Then yeah, I see it there. I didn't know if it was a Procurement, Salapi application.
No, yeah, I'm understanding that you can use the current application.
Okay, got it.
And so in this application, right? So you guys had said that in order to qualify, you have to make. There was something, man, John. It's kind of slipped my mind a little bit, but
right. Can you just break down the $300 all the way up to whatever the payment is?
Right. The maximum, right? So
right.
The household there's the SNAP benefits. The eligibility criteria goes by household size and the gross monthly income of the household. Okay. And I think during the I think there is an eligibility listing, and I think it's supposed to be about 165% of the federal poverty level, which was expanded recently. So it's going to be $300 per eligible person, and then it will not exceed $1,200 per household.
Okay.
You got that? So it's basically, John, the same application that they use to apply for the SNAP benefits is what you're saying?
Correct. And if I'm wrong, I'll get Public Health to come in and have that updated, but that's my understanding.
Right, yeah, I can't do the math real quick, because this says like household size 1, grossly monthly income of household 165% of federal poverty level. It says 1,718. That would be the gross monthly income. So if you make 1,718 with one household member, you would be eligible for $300?
Correct.
Okay, got it.
Okay.
And then it goes up.
Right. So
all the way up to
maybe we need to do like a graphic or something, Bree, to get that info out there. And John, how did you guys come up with these eligibility requirements? Is it mirroring something on like the federal side or something?
Yeah, so one of the governor's initiatives was to get this money out to the broadest spectrum possible, and so after reviewing some of the options that were available to us, this was the one that was selected in order to ensure that the COVID-19 money was used to reach the most people, and so they used the SNAP eligibility criteria, and so we feel that this will reach the widest population.
Right. How would you address, we're getting some comments here about the middle class, and I know one of the media had asked the governor yesterday about the middle class. Do you feel that this program is going to catch that big chunk of the middle class that, is unemployed or furloughed? Or
We feel that, and one of the reasons is because, people's income was affected, or family household incomes were affected by, being laid off from work, being released, because of COVID-19, and so those incomes are now impacted, and so now they may be able to qualify. More than likely, will qualify under the federal poverty guidelines for this program, and so that's why we're encouraging everybody to apply. If you feel that you have been impacted, please apply, because public health will be able to help determine whether or not you would be able to ultimately receive the program money.
And how many people do you guys anticipate that this? It's $20 million, right? How many people do you think that this will reach?
Man, the number was put out there. I don't have it off the top of my head, but I can get it to you.
It says here up to $1,200 in emergency assistance for as many as 18,000 local families.
That number sounds right.
Right.
About 18,000 people.
And John, there's a lot of confusion about this program and its relation to the federal stimulus checks, which are coming. And I put something in the comments. They're totally separate. Can you just clarify that for people?
Correct. They're totally separate. So the economic income payments that DRT just received approval for the implementation plan is totally separate from this program, and it's also totally separate from the the pandemic unemployment assistance program through the Department of Labor, and it's also separate from the dislocated worker program that's also being administered through the Department of Labor. So these are all separate funding sources, or I wouldn't say funding sources, but all separate programs where people will benefit as a result of the impact of COVID-19. So if you're looking at this holistically, then yes, there are programs that are now being rolled out. As soon as we're getting our implementation plans approved and reviewed by the federal government, there's no reason for us to hold back these programs and these monies from the people. So in short order, you will see in the next couple of, at least by this Friday, the first rollout of the Procurement and Advocacy money, and then eventually we will see the economic income assistance program through DRT, and then the PUA program and the dislocated worker program. So all four programs will be rolled out in short order.
Right. And yeah, just again to clarify, guys, it's not a stimulus check. You're still getting your stimulus check. These programs that the governor has rolled out and announced yesterday, these are being funded.
These are direct cash assistance.
Right. Yeah.
Benefits.
And this is from the $117 million that you guys have got, and that's where this is coming from. So stimulus. I mean, man, John, it was kind of crazy with the comments. People were like, "Oh, we're not getting a stimulus now," and "Oh, what are they doing with the No,
yeah.
You're still getting the stimulus. It's still coming.
Yeah.
My phone was just blowing up last night. Like 10:30, 11, all my friends were like, "Hey, are we still getting this? What's the deal with this?" So yes, you're.
Yeah, one of the basic questions that we've also been receiving is that is there a possibility that you could receive your stimulus check in addition to receiving direct benefits under the program in the Salafi Azudan Itauta program? And the short answer is yes.
So you can receive federal assistance. I mean, this is funded from federal money, and still
Correct.
You can still receive. Okay.
Yeah.
But I just want to go back to the whole middle class discussion. So,
Yeah.
Because this says it's
So basically,
gross monthly
John,
income of household, and it's up to $10,000, right? So how does this? I'm just kind of wondering, how does this help middle class families?
So, my understanding and the way I see this, and I think, I'm definitely in agreement with it, is that middle class workers, these are our hotel, restaurant waiters, waitresses, everybody, and anybody who falls under that middle class what we call the middle class, are going to be able to benefit from this because, again, their household incomes may have been affected by the impact of COVID-19.
Yeah, I know that, but there's like the Department of Labor. They mentioned early on that they're looking at 36,000 people filing for assistance through PUA and FPUC, and we're only looking at helping 18,000 families, and it looks like a bulk of that is going to come from people that are enrolled in the public assistance programs.
Yes, and that's true. So that's another benefit to those individuals who are going to be also benefiting from the PUA program. So I think if you can just look at it as a bridge for a good number of people who are part of that working class, ultimately when they start receiving their monies from the PUA program. So I think I can also agree that, yes, it's not going to cover everybody, but there's going to be a good number of people who are going to be able to benefit from this program, who are also part of that.
Man, the middle class comments are just going off, John. There's one here from Laverne. What about the middle class? People who are under the poverty level are already receiving public assistance. We don't qualify for this assistance.
I'm sorry, what's the question?
Oh, no, I'm just saying that
Just what is your
people
comment to people
are going
commenting?
off that they don't qualify, and that this is something that people who are already receiving, they receive the advance payments that Governor Liu had put out. They're receiving the SNAP benefits, and now they're going to be receiving this additional one.
Right. So again, the eligibility criteria, I think, is what we have to base ourselves on in terms of the program. So I think that, again, a good number of people will be able to fall under this SNAP program, given their changes to their income, and that would help benefit them as a bridge to the PUA program.
Right, got it.
Okay, you got it. Okay, and what about, can you provide any information on the $20 million in the CARES Act funding for small businesses?
And that's going to be run through GITA, right, John?
Do you have any information on that, on who's going to be eligible?
Can I yield to Ricky Hernandez? I don't know if you guys are going to be bringing him on at some
No,
point.
I think we definitely need to get him on because with the possibility of us going into PCOR 2, everybody wants to know what's going to be open and what's not.
Right. Hey, what can you tell us about that, John? Just while we got you here, PCOR 2, we're really pushing for Monday, it sounds like.
Yeah, so we're looking at, based on the clinical and medical data, the test results that are coming from Department of Public Health. The governor, has basically forecasted that we're looking at moving into PCOR 2 on May 11th. So, again, that will impact certain potential government agencies that have been closed, not necessarily closed, but had limited operations, businesses that were closed, and then, for example, restaurants that were not able to, or that may not have opened, but now are going to be able to open for continued drive-through or pickup service and stuff like that. So PCOR 2 basically signals that we're lifting some of the restrictions that we currently have in place. Social gatherings will be permitted up to 10, and then of course, the big question that many have been asking is the impact on worship services and being able to go to attend Mass and receive the sacraments. Those will also be clarified in our PCOR 2 movement based on the gating criteria that we're currently monitoring.
Right. Mm-hmm. Hey, John, just to be clear, when we go to PCOR 2, it's still mask up for everybody. Everybody wears masks, businesses, customers.
Correct. Yeah. We want to continue to contain the virus and mitigate any further community spread. And so simple things like keeping on your mask, washing your hands, the basic hygiene criteria for COVID-19 will still be in place. Social distancing will also still be in place in terms of staying 6 feet away. For example, in certain retail stores or actually in all the retail stores that will be permitted to open under PCOR 2, we're looking at maximum occupancy or limited occupancy for these businesses before they are allowed to open to customers. Kind of what you're seeing right now in grocery stores and, the Home Depots, where you just have to wait outside until, they allow you to come in. And so we want to maintain all those precautionary measures during this period.
The governor, she mentioned the establishment of a recovery office. When are we expecting that to be stood up, and who exactly and where is it going to be?
So the idea of the recovery office is a little bit different from the traditional recovery office that we've seen during the typhoon, during typhoon disasters. And the recovery office that we're currently looking at is something where all the information regarding COVID-19, which really comes out of Office of Civil Defense and Homeland Security, it'll just house everything that is COVID-19 related. And so, during typhoons, we have an office that's open that would administer all the public assistance programs. But in this case, because there are, this is a new pandemic for all of us, of course, the layout is different in terms of how programs are being administered. This recovery office will be basically the clearinghouse for all the programs that will be administered, but it's not going to be the one place you go to physically go to get all the benefits, but it'll be the one place where you can seek information in terms of accessing reporting that is being submitted, accessing the benefits that are available. So it's going to be a place that's going to be the centralized location for information, and it'll be like a beefed up joint information center, but it'll also serve as a clearinghouse for the programs that are being administered for COVID.
Are we going to have to go rent another space for this office, hire people to man this office, or are we just going to move around personnel?
I think, of course, taking into account that, money is everything, we want to make sure that if we are able to identify personnel internally to administer or operate this recovery program, we will do that to the furthest extent. And we also, may need to identify additional staff as the program widens. So if that's necessary, we'll also look at that. But, for example, the pool program that we're currently administering, we have detailed employees throughout the government agencies over to support that program. And for additional support, we have also picked up administrative assistants, et cetera, who can assist with making sure that when we do actually roll out the program, it's as successful as possible.
Right.
When are you looking to open up this recovery office?
So we're currently in talks with both the Office of Homeland Security and Civil Defense as well as FEMA. And so I would say in the next couple of weeks we should be able to roll out the opening of this recovery office.
John, where are you guys policy-wise, and are we just going to wait for an override of this double pay issue, man? I keep getting so many government of Guam employees. Obviously, I'm pretty sure the Guam Federation of Teachers has put their 2 cents in this. Would that $30-some million that you got, the governor had sent in her veto message, the cost of this double pay, is that something that would be covered under this CARES Act funding that we received? And is this something that the administration is anticipating on having to pay?
Wait, is it the double pay plus the differential pay with that sliding scale?
Right.
Right. So the current pay that is covered under the CARES Act is what we have identified through executive order as the differential pay. Double pay is not part of that. It is really a significant and huge impact to the ability to pay our employees, because I think, if I'm not mistaken, the number was about $3.5 million per pay period if we were to adopt this double pay. And so in light of the current pandemic, this is not like a typhoon where we have we're looking at a finite time of response, right, to being able to get everything back and running. This is a prolonged situation that we're in. And so the impact of implementing a double pay benefit is unsustainable. And so the governor but we recognize that all those individuals who we have identified as essential or critical employees to our government operations in responding to COVID, especially our frontliners, is the reason why we implemented and created this differential pay based on the sliding categories of the 25, the 15, and the 10%, is to ensure that those individuals who have been activated to duty and have been been called to report to work to respond to this crisis are compensated. And so, it was the fairest, the most economic, and in my opinion, the most impactful way we could give the employees the benefit of being able to respond.
Let me ask you this, John. Under the sliding scale plan that you just talked about, would people like Becky Respicio and Alice Tyron, who are managing the quarantine/isolation facility at Pacstar, would they get the same COVID differential pay that, let's say, a nurse working at GMH would get under this plan that the governor put out with the executive order?
Their current, I don't know the final category that they have been entitled to. It may be 15 or it may be 25. But at the end of the day, do I think that these?
But I thought cabinet members weren't going to be receiving.
Yeah, the governor
this
said that
differential pay.
in the press conference. I think it was, I want to say about 3 weeks ago. I can go back and find it, but she said that none of the cabinet are getting it.
All right, so
But then yesterday she said that they are getting it, right?
So
I don't know.
she did.
I don't
At that first press conference, I'm remembering the press conference that she said that they wouldn't be entitled to it, and she made that statement. The executive order reflects differently because these are individuals that we have who really, at the end of the day, volunteered. I don't want to use the word volunteer. That have responded immediately to the crisis, and so they have put themselves in a situation where where they were expected to.
No, I get it. I get that there's exposure. I'm just saying, like, under the governor's
but at the
plan.
same time, they volunteered.
Yeah, I mean, who wouldn't volunteer to get an increase in pay?
Employees that said we want to, they have to work.
Yeah.
You know what I'm saying?
I mean,
They said they volunteered.
And so,
the use of the word volunteered was incorrect.
voluntold maybe.
Yeah. Maybe voluntold, but these individuals really continue to put themselves at risk.
Yeah. No, we're not saying that. I'm just saying, like,
and at the same time, they're not even classified employees.
Yeah. Mm-hmm.
So you're saying unclassified, these people that volunteered, didn't volunteer, voluntold, they're still going to be eligible for all of this differential pay.
Because in the executive order that allows for it, those individuals, unclassified or not, have been identified to this differential pay because of the risk that they have assumed in being exposed to these to the.
So basically, everybody that is working right now, whether it's yourself, you would be eligible now.
I don't know. Would you be eligible, John?
No, I am not. I am not receiving any differential pay for.
But again, what can you tell us about? I just want to go back to my question that I asked you earlier. Are Alice and Becky making the same type of pay that, let's say, a nurse who's at the clinic or in the hospital would get?
I don't. I have to look at the categories as to what they're actually going to be getting, but I'm not sure. I can't confirm whether they're getting the 25 or the 15.
And then how do we leverage what the governor has said on the record in that cabinet members aren't going to be getting this? I mean, I'm going to go back and find that thought because I think that she really expanded and said none of the directors are getting it. I'm not getting it.
She did say that, and then I think in the subsequent press conference, she did clarify based on the executive order the language towards the bottom where it says, employees of the office of the governor, or it may have said unclassified employees who are directly responding to COVID, to the COVID-19 with possible exposure to that population, may be entitled. So, I'll look at it again, and it's worth reviewing.
What do you think, though? Do you think that Alice and Becky should be getting the same COVID differential pay that a nurse or a doctor or a fireman or a policeman or a guardsman person? Do you think that they should be getting the same differential pay that our real frontliners are getting?
I can't say that they're doing the same work, but I can say that they put themselves in the same risk, to a similar risk exposure, in being able to assist, the individuals in the quarantine facilities, and so that again is a risk exposure that is there, that can't be denied.
Mm-hmm. Well, I wanted to just because to me it seems like there's two different issues. You have the executive order sliding scale differential pay based on exposure, but you also have a separate issue of double pay that's already, from what I understand in the Department of Administration rules and regs, that these frontliners are eligible for and are supposed to already be paid, and yet they haven't. Why is that, and are they going to be paid?
Okay, so the bottom line again is that the governor in this current situation, unlike any other natural disaster, this pandemic is really unique in terms of how we're operating as a government. And so, the fact is the governor has recognized that, there absolutely needs to be a benefit to these employees, particularly our frontliners who are out there every day. And so that is the reason why they are receiving the 25% differential.
I'm not talking about that, though, John. I'm talking about what's currently in the Department of Administration rules and
double
regs.
pay,
Right.
Yeah.
It says those employees required to remain on duty to provide essential services shall be paid at double the regular rate or granted compensatory leave credits for the hours worked during the period the facility is closed and the other employees are on excused leave. And additionally, this was included in a letter that Senator Joe S.N. Augustine wrote to Mr. Edward Byrne.
Mm-hmm.
And they're wondering, are they going to get their double pay aside from Bill 324 that's sitting with the legislature?
John, everybody's talking about it. Government employees,
You do know what I'm
kinda,
talking about.
They're mad about it, honestly.
Sure. Yeah, and of course, but because there is this differential pay that has been implemented, that's what we're following. And and if the legislature recognizes that, as in terms of being able to pay out this double pay, then I think they can assist the administration in being able to identify the funds that would be used to do that. The bottom line is that we are in a prolonged pandemic. We are in a prolonged response to this crisis, and in order to keep our government operating the way it is, in order for us to continue to provide the essential services, to continue to pay our employees, where other governments have furloughed their employees or laid them off, we continue to pay our government employees, and we are doing our best to ensure that we're on track to a strong economic recovery. Implementation of a program like the double pay, keeping in full mind that we recognize that we have to compensate these employees, and that's why there's a differential pay. But keeping in mind that we recognize that we need to pay them, implementing the double pay, the differential pay, in addition to other benefits that they receive, the double pay question is extremely, and I have to say this profoundly, is that it is unsustainable in order to keep our government running.
Mm-hmm. But it just seems like what GFT had said, that it's like we're changing the rules of the game when we already had this double pay in place. And now we're going to change it, and we're going to say, let's do the differential pay and do this sliding scale.
You can agree. I think we can all agree that the rules of the game change when the game changes. And so we're in a different game. We're not in a typhoon response. We're not in an earthquake response. We're not even in dengue fever response.
Yeah.
We're talking about a prolonged pandemic crisis that we do not know when the end is near.
Yeah. Yeah, but John,
but the players are the same.
Yeah.
Them being the front liners.
What if you guys were to do something like, I don't know, effectively manage the number of people who are responding and who would get the double pay? I mean, we were anticipating this huge surge. That turned out to be inaccurate. I mean, thank God.
And an emergency is an emergency.
And if it's unsustainable, then maybe we need to do like how we're doing it with our response, where a few weeks ago we were trying to get 1,000 hospital beds. Now we're just happy with 10 or 20 or whatever. So would you guys be able to kind of go through and be like, okay, we're going to pay the double pay. Obviously, we're going to have to scale it back, and not everyone's going to get it.
Right. So I think the reality is that yes, we have 5 deaths related to COVID. Our numbers are at 140. We've been able to maintain a good pace of the 0 to between 0 and 2 positive in recent days. So that is a reflection of everybody's effort, not only the administration, but everybody's effort to sincerely combat and mitigate this virus. And we've done it, I think, in all fairness, everybody has done a good job to do that. And we recognize everybody's effort. So yes, are we looking at being able to adjust our plans because, we no longer need 1,000 beds, or we don't need there's a possibility that our, additional care facilities may not be needed. But, at the end of the day, we're not out of the woods yet, and those options should still be available to us.
We had a comment here.
These are resurgence, or there's the numbers. There's an uptick in the numbers.
Right. We had a comment here that the personnel rules and regs don't say typhoon or pandemic; they just say emergency declaration. And so, John, I guess just can you specifically speak to the government of Guam employees who have been working this COVID-19 crisis, working this COVID-19 public health emergency with this double pay chip on their shoulder?
Sure. So, to our government employees who I've seen day in and day out during my time in helping to assist to respond to the crisis, first off, on behalf of the administration, we say thank you. And I think, those are not hollow words that we take for granted. We recognize that every single day, our doctors, our nurses, our GMH staff, everybody who has been part of, the medical clinical response, to include our public safety, the health officials, Department of Public Health, everybody acknowledges, our entire island community acknowledges the work that you continue to do day in and day out. Now, on the issue of the compensation, we as an administration have assured everybody that we will pay out this differential pay, and that should be administered or be paid out very shortly. And I'm thinking that it's in the next couple of days. And so we continue to ask for your patience. We continue to ask for your trust, and that we will continue to take care of our frontliners and our employees as we have done since day one. And so the issue of the double pay is, if that continues to be a sticking point for our government employees and those responding, then we're asking for everybody's help, particularly the legislature's help in being able to identify the funding source for that. So again, we are in this for the long haul. Our response is gonna determine, our continued response is gonna determine how we're managing this crisis. And I think, by all accounts, everybody that has been a part of this process has done an excellent job. And so, we thank you, and we will continue to address these issues as they come up.
Okay, just for ultimate clarification, John.
Sure.
Ultimate clarification.
The mandated double pay, that's by law, correct?
It's in the personnel rules and regs.
Is that by law? Is it mandated?
It's not statute.
Okay.
It's in the personnel rules and regs, which governs the operations. But again, those rules and regulations were at a time when this pandemic crisis. I don't want to say may not have been part of the plan, but I know that we're in a different situation here, and so in order for us to again.
So just is it a law or not?
Well, he said it's not in statute, but it governs the personnel rules and regulations.
Personnel rules and regs. So it's not I'm not.
Are you trying to use that as a loophole, John? That it's not in statute.
Because I think that other people would argue that it is. Yeah. I mean, but be that as it may.
Be that as it may.
Okay, it's in the personnel rules and regs for this double pay.
So are there other? You guys just feel like you don't need to
through
follow
the Administrative Adjudication Act. Is that a law?
That's the law.
Okay, so if it was adopted through the Administrative Adjudication Law, mandating this double pay, it's a law.
Right.
Okay.
Yes, but the governor also has the authority
to trump law with an executive order.
Not to trump law using an executive order, but she has the authority, to in this particular case again create a pay structure that is responsive to the current crisis. So I think that's.
Does that have to be adopted through law, or are we
that's
claiming Title 10 superpower authorization?
No, that's under the public health emergency. I'm not sure, but so I'd be happy to get back to you on that.
Right.
Okay, so now let me just go back to my question. So this double pay enacted through law, through the Administrative Adjudication Law in the Department of Administration rules and regs, mandates this double pay be paid to essential service employees.
Mm-hmm.
Are they going to get paid? Or are we going to stick with the executive order through the sliding?
The current plan is to continue to stick with the differential pay structure that has been implemented through executive order.
Okay, and so we're not going to pay the double pay based on what's currently in law?
No.
Okay. No, that's crystal clear.
Okay. What if they override the governor's veto of the double pay sliding scale bill from Vice Speaker?
That's the prerogative of the legislature, and we've been in communication with them, and so the recognition is that the governor again felt that this particular bill was going to be unsustainable, and so because of the economic impact. So if we're able to identify the funds and ensure that it's going to be again will not impact our government operations to the point of having to furlough or lay off employees, then I think it's fair to revisit the situation.
So if they do override it because they just overrode the governor's veto of the Bill 333, how many employees would you guys anticipate getting furloughed?
I don't know. I don't have that number in front of me.
And just so we could just get you on the record, John, if they do override that veto, you guys, the administration, will be forced to furlough employees.
There is a very strong possibility that will be the case.
And how would you determine who gets furloughed first? Would it be the non-essential or?
There is a very specific and outlined process for that. This is not the first time that this has been done. So I know that the Department of Administration. I think Ed's going to be on later on. So
he is, yeah.
I'd like to punt off that question to him.
Okay, so we will. Hey, but John, just real quick, you're the acting chief of staff. How long are you planning to be in this slot? And can you confirm? There's a lot of rumors about John Uggan maybe taking over. So just, I guess, roundabout, what can you tell us about your status as the acting chief of staff?
Sure. So, in my discussions with both the governor and the lieutenant governor, again, our first priority is to continue to respond to this pandemic. I'll continue to serve in this acting capacity until, the governor finds fit to either find a person to fill this position or, make a decision otherwise. So, again, our priority is to respond to this pandemic crisis, regardless if there's a chief of staff or acting.
What about the John Uggan thing?
To the John Uggan, that's the I'm not tracking that. I had a very good conversation with the senator yesterday, who I continue to personally rely on, and the administration relies on for good counsel and guidance. And so, I have not heard or am I aware of any indication of that selection.
This is kind of a crazy one, but can you confirm anything about Tony Babauta being tapped to lead GVB?
No, I don't.
Okay.
I don't think that's happening.
Do you guys have any candidates in mind, or?
Even during the transition, there have always been a good pool of candidates who are able, willing, and ready to fill that position. And again, that would be the discretion of both the appointing authority and the board, or who is the appointing authority on the recommendation of the governor.
Okay.
But of course, that's going to be a very strategic position to fill, given that tourism and economic recovery are going to be significant. It is a significant industry that's impacted by this pandemic. So,
right.
We need
so,
to be
hey, John, I know. So we're doing last question. We're doing the gradual reopen Monday, May 11th. What about flights into and are we going to see any more flights, or what's this? Is anyone tracking that?
Right. So opening up incoming flights again is not of the utmost priority for the governor. Obviously this virus has we can safely assume that this virus has also been spread because of incoming flights, and so there's no plan to open up the airport again. I mean, not that we've closed the airport, but to permit flights to come in.
Okay.
Is there going to be a press conference today? I just thought I'd ask so we can, if there is, we can make plans.
I think we gave 3 hours yesterday.
Yeah.
Right. Yeah.
No, I just wanted to see if there was.
I have to. I'll check in this morning. Again, we want to make sure that we're.
Well, we don't expect you guys to do a 3-hour press conference every day.
No,
I know that we did want information. Maybe if we can get Ricky on here, maybe Friday or tomorrow, just on the whole the business guidelines.
I know that we've committed some type of lineup, to make sure that we get this information out, and that's our responsibility and our job. So we have no problem doing it.
Okay, thank you, John.
Thanks, John.
Chris, Bree, have a good day.
You too. Wash your hands.
Thanks. Bye-bye.
Bye.
7:29. Hey, we got to take a break. We got Dr. Tom Shea. And then I wanted to bring on Attorney John Brown. He kind of wrote the book on procurement and get his take on this news surrounding procurement, emergency procurement during this COVID-19 pandemic. 7:29, we are the KUAM News takeover of Guam's favorite containing COVID. Good morning.
KUAM News. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Good morning. 7:35. 637-0094. That's our number. I wanted to get Attorney John Brown onto the show here. Good morning, John.
Good morning, Chris.
So I was trying to think of how to explain your background, and I don't know if it's an oversimplification, but you kind of wrote the book on procurement.
For Guam.
For Guam, yeah.
Yeah.
And so, that being said, I know you've been following current events, and I don't know if you want to speak specifically or generally on the way that you handle procurement during an emergency. And so we're now in a public health emergency. So, just really wanted to go to an expert, and I just want to give you the floor and tell me how it's supposed to go.
Well, you're right. Answering a question about procurement in the abstract is capable of misleading very easily, because so much of the law, not just procurement, depends on the particular facts. But in terms of outlining the law, there is, for general procurement purposes, an emergency procurement process that the procurement law prescribes, actually. But then it turns out that there are other laws that are applied. So it's not just the procurement law that you have to be mindful of. The procurement law has a very horribly written emergency procurement statute that fundamentally is meant to be universal, and it's but there's a very specific definition of emergency procurement that sometimes is a big issue. But in this case, I don't think anybody is questioning the validity, and I certainly wouldn't, of the declaration of a public health emergency. That then gets us away from the procurement law. But let me just say that in the procurement law, in that emergency procurement part of it, it's a very complex, as now written, provision. It bounces around everywhere. But the bottom line in the procurement law, emergency procurement, section 5215 of the procurement code, says that emergency procurements have to have this and they have to have that. They've got to do this within certain time frames and all of that. But there's a bottom line, provided that that emergency procurement shall be made with such competition as is practicable under the circumstances. So from the procurement law standpoint, providing competition in your pricing of your purchases is a means of making sure the government gets good value. Because what we don't want is to have expenditures fraudulently or misapplied. That's not good for us, not good for governance, not good for you and me and everybody listening to have their money spent willy-nilly. And so that's what the procurement law is trying to do. But I don't think that the procurement law is going to be the prevailing force in this. There are two emergency laws that are applied generally to health, one more specifically than the other, perhaps. There's a civil defense law that makes the Civil Defense Authority on Guam responsible as a center for us for dealing with primarily military, but not entirely, also natural disasters situations. And it dovetails that was written back in 1952, by the way, or passed in 1952.
Okay.
So that's been around a long time. Then more recently, in 2002, there was a public health emergency law that was written. Both of them are fairly well overlapping each other, and to the extent that they are inconsistent, it creates some confusion as to what exactly is the source of the authority for doing something. Not even the governor can just do whatever the governor wants to do. Nobody has the right to do anything unless there is an authority given to them for that right. And the Organic Act is, of course, the starting point, but then there are all other statutes as well. So it gets a little confusing, and then once you find the law that would be applicable in its broad terms, is it applicable in its exact application to the facts there? For instance, there's been this question about a forgery of a digital signature.
Right.
And I see in the paper this morning that the governor is saying, and I'm not disputing this. I'm just saying that these are the forks in the road. That it's plausible that the director didn't remember authorizing that one. Well, yeah, that is plausible. And until we can decide what is fact from what's plausible, we shouldn't jump to any kind of conclusions.
I mean, it's also plausible that she didn't forget.
That's what I'm saying.
John, so I know you're a sharp guy. You're paying attention. You're reading. You're watching. I just want to get your take on this whole situation with this procurement, because just outside looking in, I want to bring in somebody who knows what they're talking about, and obviously, you teach procurement. You've been in this game for a long time. So how does it hold up? We've asked Lieutenant Governor Josh if this passed the smell test. He said red flags. The procurement oversight of the legislature, Senator Sabina Perez, said that it doesn't pass the smell test, and she specifically referenced the use of Linda DeNorcy's digital signature without her approval or knowledge or remembering or whatever the situation is now. What is your take? Does this, based on what you're able to glean from media reports, does this emergency procurement that we're seeing pass the smell test?
Well, the smell test isn't a factual test. It's just that it doesn't smell right. But, you've ever eaten a durian? Smell isn't the ultimate test. And it's one of the first things I teach in the first day of teaching procurement law is that the procurement law applies to a lot of things, but not to everything. And there are competitions and such as that fall outside the scope of the procurement law. So even if it's within the scope of the procurement law, there are methods of enforcing the procurement law. And if you don't elect to use those methods, then there's no enforcement by the procurement law. For instance, procurement law sets up solicitation rules. You have to solicit before you buy. You have to do market research. But it suspends that in the case of an emergency. As I mentioned before, as long as there's competition, it really satisfies the fundamental need of emergency procurement. But there's even something further than that. Suppose you didn't do any of that and the procurement was made, how are you going to enforce it? Because the only people, the government can't enforce its own rules to benefit a different kind of an outcome. The only way a procurement can be challenged is by a protest.
Right.
And a protest can't be brought by just anybody. It has to be brought by a actual or potential bidder. And so suppose we have some of those out there that didn't take part in this. They didn't protest. And there's a timeline. If they don't protest within that timeline, then there's no right to protest. So it's not everything. It's not as onerous as people like to think it is. And in this case, if there was a case for violating the procurement law, it hasn't been raised by a protest within what I think is probably the time. I mean, you have 14 days from the time that you knew or should have known of the facts by which you think there might be a reason to protest. Well, the facts have been bounced around in the paper for weeks. The procurement law isn't the issue here. The procurement law, the issue I think is going to arise under the health emergency procurement rules.
But how can you file a protest if a contract wasn't signed? Would a contract need to be signed and then you could file a protest?
Yeah, because according to the Attorney General's office...
No, stop. Contract follows solicitation.
I see.
And the protest is of the solicitation. So the fact that it didn't do it, it wasn't. You're claiming it wasn't signed. That changes from a solicitation rule to a rule. It may relate back to that, but a contract dispute. Did you actually have a contract? And that narrows the numbers of participants in that dispute. It's a needle in a haystack when you go looking for this stuff. And everybody sees the haystack and think, well, it's in there. Okay, you got to find it. You got to find it exactly where it is.
You find it.
Yeah.
I don't have my glasses.
Yeah, I'm sitting here with mine on, and I can't even read with them.
So, John, I guess, because we got a few other, I want to ask this, and it kind of seems that, I don't know if it's just, Lord knows we have problems with the procurement, right? But there's just so many different things that we haven't been able to, I guess, wrap up with procurement. Like, we've got the protest of the senior meals. There's the, protest on the prison meals. So I guess just generally speaking, is it really that complicated? Because, the governor has said, we need to overhaul procurement. And she cites all these different examples of us not having anything firmly in place because of protests and stuff. So is it really that complicated to follow the procurement law, or is it so problematic that it makes it impossible for the government of Guam to do business with people?
Let me just say, it doesn't matter how you write the procurement law. There's always going to be room for judgment calls, rooms for mistakes to be made. Procurement has been going on since the days of the Romans, and before that probably. And so there's always dispute about that. But you don't shut down the whole thing just because you have disputes. The whole purpose of that is to intervene in those disputes and reach a result. Just resolve the dispute once and for all. So, could it be improved? Absolutely. For the last 2 or 3 or 4 legislatures, I've been involved in trying to get the beginning of a broad procurement reform bill passed. It was vetoed 4 times or pocket vetoed, absolutely vetoed by the last administration. So it never got to the light of the day. One of the things that has in it is a emergency procurement reform, because as I said, it's woefully written. And that's been sitting in our legislature here for a while, and Senator Paris has taken a really good interest in procurement, but of course she's got a full plate too. Right. She attended the procurement classes. Excellent student. She picks it up very well. She understands what we're trying to do. But you can only make it do so much, and if you broaden it too far, then you kind of lose its focus. So it hasn't gone anywhere at this point. So I agree. There's a lot of room for reform. I've put a lot of work into that in the last few years, but it hasn't found any traction.
I did want to ask. There was something that the Carlo Branch had mentioned. I believe it was yesterday we talked to him regarding. We were talking about this whole procurement for the isolation / quarantine facilities, and he was saying that under Title 10. When it gives the governor these emergency health powers, these superpowers when it comes to procurement.
Yeah.
Is that
okay.
is that correct?
The Title 10, as I said, the procurement law is not the only law. Title 10 is another law. This is the public health emergency procurement rules, and there's another one more or less in the civil service, civil defense, not civil service, civil defense procurement rules. They're not procurement rules, but it has a emergency procedure in there. But the emergency powers, again, you have to look at them closely. And so, what are the emergency powers under the health emergency? Says that the governor may, through an executive order, suspend the provisions of any. And this is where it gets complicated. What can the governor suspend? Anything? Any and all? No. Only the regulatory statute prescribing procedures. Well, first of all, regulatory statute, I've never seen that phrase. I mean, a statute is a statute, and it regulates things. That's why you have statutes. So I don't know if this is a particular kind of a thing. So already we're being into it. Well, now, wait a minute. What can't you suspend? A regulatory statute prescribing procedures for conducting local business. Well, what statutes do we have that prescribe procedures for conducting local business? What? We don't have any that I'm aware of. Fraud things, health things, but they have to be pretty carefully defined in order to provide notice to the public as to what are we talking about here. So this one already kind of raises a little bit of a red flag about, well, what can be suspended? Is it prescribing procedures for conducting local business or the orders or rules and regulations of any governmental agency? But okay, so that's the beginning of it. And then there's even a further qualification on that. It says, to the extent that strict compliance with those rules would hinder necessary action, including emergency purchases. There's your procurement provision. And so to the extent that strict compliance, well, the procurement law, as I said, it's got in the emergency procurement part, has a lot of conditions about notices and who's got to make declarations and who can do it and when you got to do it and for how much can you do it. But as I said before, there's a provision that says, provided that emergency procurement shall be made with such competition as is practicable under the circumstances. A very reasonable standard, but it's not specific. So what is the procurement law provides a lot of excess stuff in it, but it seems to say, but if you boil it down to and you give competition, so did the government give competition? I don't think you can ignore the procurement law simply because in a strict application of every part of it, it gets kind of cumbersome. Because there is a way to cut through all of that and just say, well, we've done, time was short. Time was really short. This was a really severe, it's an ongoing severe and nasty emergency. Can't disagree with that. But the procurement law says at least you have to provide competition. And did you? Well, again, looking at the papers, it appears that the governor's office did make a overture to the Hotel Association, because what they weren't acquiring books, they were acquiring hotel rooms. And evidently, some discussion with that. They identified 3 or 4 different hotels. Well, the procurement law doesn't require that every possible bidder get approached and be offered. It does require that you make as public as the solicitation as you can in the circumstances. But even if you've given that some of the notice, you only have to get as such competition as will give you the best price. That doesn't mean getting every hotel on Guam. It means getting 4 or 5, right. 3 or 4. Mm-hmm. And bottom line for some of the rules in procurement are you have to get at least 3 quotes, or you have to ask for 3 quotes. Getting them is something else entirely. So it's not. There's a rule of reason here, and the procurement law understands that. So the very first section of the procurement law sets out some principles and said, if when you go to apply this law, these are the principles that guide you. One of them, major one, is that you have competition. So if you've satisfied the competition rules, you basically satisfied the intent of the procurement law.
Okay.
Wow, thanks for that TED Talk. I mean, yeah, that's why we wanted to get you on it and give you the floor. Mm-hmm. And that was, for all you procurement geeks out there.
Yeah. Well, I mean, it sounds like the governor does have some superpowers under Title 10. She made the effort by reaching out to GHRA, Mary Rhodes, in trying to find quarantine and isolation facilities amongst the hotel groups. And I guess these hotels, it appears, had stepped forward because other hotels were like, hell no, we don't want to have a quarantine in our hotel.
Yeah, well, that's it. There's other rules. The principles, though. The principle is that you have to have safeguards for a a procurement that is has integrity. And again, if you went out and you sought solicit competition and you got adequate competition, that's what's really important in the first instance. But if you're treating, because another one of these principles is that you treat everybody fairly and equitable.
Mm-hmm.
So if you've done everything except treat people fairly, you've dealt with preferred customers, then you haven't completely satisfied the fundamental principles of procurement.
Mm-hmm. But who should be handling procurement issues? Should it be the chief procurement officer of the government, or just whoever the governor says she wants to handle it?
Well, the CPO, Chief Procurement Officer, has the overall responsibility for the whole territory to conduct or supervise procurement of all supplies and services. A lease of real estate is a supply under the definitions in the code.
Right.
So she has supervision of that, if not the carriage of it. Certain agencies are given the power to procure, their own power. They can go out and conduct the procurement. They have to do it in accordance with the procurement law, but they can do it. They don't have to go through the GSA. So I was about to run into some weeds there, but
I was just curious, is that the responsibility of the legal counsel to go out and negotiate?
From what you're saying, it sounds like the chief procurement officer,
or if it's the chief procurement officer,
should have the final say
to be doing this.
I don't think that the governor's office is the appropriate person, because under the health emergency procurement, this is given the charge to the director of Department of Public Service.
Public health?
DPH, public health. Yes,
yeah.
Public health administration. They are given the authority to execute this health emergency under Title 10, Chapter 19. So it's their carriage. The governor, of course, can instruct the head of that agency, but ultimately it's the head of the agency's call. And having the governor's personal attorney go out and do this is a bit presumptive. Now, there's nothing preventing them going out and finding out sources and that sort of thing, and letting the public health director know about that, but should not take direct part in doing it, because that's not an authority that was granted to the governor. And again, it's badges that count. And particularly the governor, because there's some of these provisions in the law that talk about the authority to do this, and includes the governor. The governor, by definition, is an official of the executive branch. Is the head of the executive branch, and that makes the governor's office an agency under definitions of what is an agency and that sort of thing. So they all are subject to this authority, and there's several cases from the Guam Supreme Court that says you can't assume your authority if you're part of the executive. You have to identify exactly where it is. You have to point it out in the law. It's not my job to go out and tell them you don't have the authority. It's their job to point out where their authority lies. And the governor's tried to do that, but got a little bit coy with, as I said, the full extent of this emergency power.
That's really interesting, John. I mean, wow. So you're basically saying that Linda DeNorsi
has the superpowers.
Has the superpowers, not the governor, not her legal counsel.
During a public health emergency?
Because it is the Public Health Emergency Powers Act, right?
Yeah. Yes, that's right. Again, the governor has persuasive powers and can use those persuasive powers. But the person who signs off on it is the director.
Who has
whether she knows or not, digitally. John,
well,
yeah, that's something for us to get into. John, I appreciate your call so much. We're at the top of the hour.
Thanks for the clarification.
Yes.
Sure.
And let me know when you got a class. I think I want to sit in with one of these. This
yeah.
pretty interesting.
They're booked out, and of course we don't have classes.
You don't have online?
Look, I'm 71 years old. What is an online?
All right. Thank you.
You bet.
Thank
Take
you.
care.
That's Attorney John Brown. He wrote the book on procurement, and he definitely had some very insightful things to say.
Mm-hmm.
And
I got from that Linda DeNorsi has the superpowers.
Right, not the governor. That's pretty interesting. And I mean, it kind of makes sense, and we kind of heard this before.
During a public health emergency.
Because it is the public health, it's the Public Health Emergency Powers Act, right?
No,
Or
it's
something.
it was the Title 10 Emergency Health Powers.
Yeah, that
There's
one.
like, so many different provisions in there. I'm not an attorney, but
All right,
he's
so it's
the one who Emergency Health Powers. Title 10, Chapter 19, Emergency Health Powers.
Right. And so it is 8 o'clock. We're KUAM FM. I got you, Guam. We're going to do news. We got Ed Byrne from Department of Administration, but just really wanted to get Minority Leader Senator Tello Taitagui on the senator. So that session yesterday.
I'm sorry, say again. Sorry, Chris. I took you off the...
No worries. Senator Tello Taitagui. So I guess just first of all, what did you make of that session yesterday? It was pretty interesting. There were some great comments on the floor.
They were great. The first half of it was great. Senator Therese Trelawney explained the reasoning very well. And of course, I'm very passionate about this bill. I truly believe in transparency. And said my 2 cents. I am quite surprised of Amanda Shelton voting no on it, but maybe because it was her birthday, she thought she could pick two things. I don't know the reason, but first, good morning to Chris and good morning Sabrina as well.
morning.
And by the way, Sabrina, what do you do to keep in shape? You're on all the time. I'm sure you're up in the morning, and I know you're work. You like to work out. I mean.
Oh no! I haven't.
Weight, but you.
I haven't had a chance to work out in a while, but I run back and forth here at the station because the radio studio is in the front,
right?
The newsroom's in the back, so I run back and forth.
So you do your training. So you got this path going back and forth.
That's about it.
You look great. And same here. I try to do the same when I get on the treadmill and listen to you guys in the morning and try to get the news because you're not getting it from Adaloop. They're ignoring our letters and our phone calls to meet. And by the way, because I'm going into a meeting here real quick, did she say it's going to be Core 2 on May 9th or now May 11th?
May 11th.
Yeah, we thought it was May 9th because I could have sworn they said it was May 9th.
They said it was May 9th, but guys, May 9th is a Saturday.
Right. And
so,
plus it wasn't like set in stone. It's like we're looking at May 9th depending on, how the tests go. And
rapidly evolving.
The 4 triggers. And so
Okay,
yesterday
so
it's May 11th. Yeah. She said May 11th.
Now it's May
11th.
May 11th.
Mm-hmm.
Okay, because I had people calling me just as confused as I was. So, first she said you're thinking about adding extra on May 11th. That's what I came out.
Right.
Look, I mean, it sounded to me. But the second part to your question, the second part of the session was very disappointing. We are out of the loop. As you can see, the 4 of us was raising our hands to go back into motions to address some of the other bills that we thought was important. And unfortunately, they did not tell us what their plan was because it was obvious. The Democrats had a plan, and that was not to include the Republicans.
Well, yeah,
So
that's nothing
it's
new.
very frustrating. Yeah.
Senator, can I just ask you, because I know you're going into a meeting and we got Ed Byrne on the line, and it just seems every time you call up, we got someone on your back. But I just wanted to ask, what happened when after Senator Amanda Shelton went and made her floor speech about Santa Maria Common wouldn't want us to override this veto? Senator Regine Bisco-Lee called for recess. And I saw the footage. I know there was something on Facebook going around where they did a malfunction style overdub. But I watched the session footage and I was able to zoom in, and it appeared like, was Senator Regine Bisco-Lee calling people to fight, or what was happening there?
I didn't make it out. With the mask on, it was very difficult to hear what they're saying. And
come on, Senator.
I don't know, seriously. You know me, I would have gotten up there and listened to what she's talking about, but it was absolutely, she was kind of chewing out Amanda for something like, why did, it sounded like, what the whole video was saying, why did you read that letter night? I was like, what are they talking about? I
Yeah.
didn't bother to go back there because whatever they're doing, their plan, it's not going to stop this override from happening. You know, obviously it wasn't going to stop it. So I don't know what she was saying. Now I asked. I wish I did so that I can let you guys know.
Well, you tell it to Chris.
Yep, I would tell you exactly.
Let me know.
But it is.
Yeah.
But I seriously, I don't know. I think Talina Nelson, she was right there.
She was, yeah.
And so was St. Augustine, and I know you talked with Senator Nelson.
We're best friends with Joe St. Augustine, Senator Joe St. Augustine. Now we are.
Now he's calling
Yeah.
you. Now he's calling you. But
Right.
it's going to be an interesting SES meeting. That
Right.
for sure. It's going to be very, very interesting.
Yeah.
A
Is
lot of
that today?
questions can be asked. I know that's tomorrow.
Right.
Okay.
Yeah, and we actually have Director Byrne from Department of Administration on the line. Senator, let's make time to do our weekly thing. Maybe tomorrow, Friday, catch up. Maybe after this SES meeting.
Yes.
No worries. Yes,
Okay.
yes.
Okay. Thank you so much, Senator.
Okay.
Okay. Be safe.
Okay.
Take care.
Enjoy your meeting. Wash your hands.
Yes. Okay. Thank you.
Treadmill hard.
Bye.
Okay. That's Senator Telotati. Let's go over to line one where we have Department of Administration Director Mr. Ed Byrne. Good morning, Mr. Byrne.
Good morning, Chris.
Thanks for joining us. I guess, we had the Acting Chief of Staff, John Jr. Calvo, on, and we were really going deep into this double pay issue. And he answered a lot of stuff. He stood in, he took the shots, but at the end of the day, he said that he was going to punt it off to you. So I guess we'd start with that.
Right. I know that Senator Joe St. Augustine, he had written you a letter regarding the double pay issue and wanting an explanation as to why the double pay was not being paid out.
Yes, and I wrote back to him, I think he got the letter yesterday, explaining all the conditions.
Okay. Well, I haven't received the letter. Can you explain it to us why? Because John Jr. said it was not going to be paid.
No, it's not going to be paid. I'll quote from the letter, if I may,
Okay.
and tell me if I'm going too fast, and I'll try and slow down, right?
Okay.
The governor signed Executive Order 2020-03 in March 14, 2020, and declared a public health emergency. As a result of this executive order, non-essential government operations were suspended, and certain agencies which perform the central operations were required to designate and required to report to those employees whose job duties covered tasks directly or indirectly associated with minimizing the damage caused to the population of Guam by the virus. Those employees whose job duties involved non-essential activities were required to remain at home. You recall that executive order, right?
Mm-hmm.
This second group was not placed on administrative leave with pay, as was said in his letter. They were to remain on duty during normal working hours, ready to report to work at 2 hours' notice. And I don't know about every agency, but we've certainly exercised that option at Department of Administration and brought people in to do something where we thought it was necessary. And if their duties permitted, or if appropriate arrangements were made, they were required to work from home. Since they were on duty, they were and are being paid regular pay at regular rates. Rule 8.406C2 states, and I added an emphasis, and I'll indicate where the emphasis was, those employees required to remain on duty to provide essential services shall be paid double the regular rate or granted compensatory leave credits for hours worked during the period the facility is closed and the other employees are on excused leave. As you may see from the comments above, the facilities at which essential workers were carrying out the duties were not closed, neither were the other employees on excused leave. The Department of Administration concluded that Rule 8.406C2 did not apply in the circumstances which we're currently experiencing. And the letter goes on to talk about the financial resources that would be committed were we to pay that double rate.
And what's that?
Could you go back to that 8.4? You said 8.406?
Yes, that's what the senator quoted in his letter.
And it does not apply. That's what you're saying?
It does not apply in these circumstances because those conditions are different from the conditions set forth in that rule.
What were the conditions that were set in that rule?
During the period, this is the emphasis, during the period the facility is closed and the other employees are on excused leave. So, I mean, the whole point of having everybody on regular duty is that whenever something needed to be done, as I say, this certainly was the practice of the Department of Administration, we brought people in to perform those duties. And if the duty was complete, then they were permitted to go home. If the duty was not complete, they had to stay at the facility to complete those duties.
Okay, so I'd have to see a copy of this letter to
What about
really
overtime,
digest it, but
Mr. Byrne? How are we doing with overtime during this pandemic emergency declaration?
Do you mean are people working overtime? Chris?
Yeah. And how much?
Well,
we
yes,
got any figures?
there are some people working overtime, but you recall the executive order required payment of overtime to non-exempt employees, and the overtime had to be approved by BBMR, and we have had and paid for some of those overtime claims.
Which agencies are we seeing? Is it just the typical, public safety agencies?
Yes, I think it was mainly Homeland Security who did most of the overtime. But I think there's been some going on, naturally at Public Health. But I don't think they habitually work overtime.
Right.
Because they're in my office, a lot of them, and I see them working not extraordinary hours. Although there are some times when I have seen them work beyond regular working hours.
And then, so I know we're talking about the double pay, but the governor's executive order with that sliding scale and the COVID differential pay, has that been paid out yet?
We're paying it out on Friday. We got all the timesheets in for the 2 weeks. You recall the emergency started around, I think it was March 14th, but the executive order can't be retrospective. So we're paying out 2 pay periods. I'm sorry, I should say 2 weeks. It's 2 pay periods of 2 weeks each on Friday, based on the information which we're receiving from agencies. And they were due to send in timesheets on Friday. There was still some outstanding yesterday, but we were chasing them up.
How much money are we looking at paying out in COVID differential hazard sliding scale pay?
Well, we don't know yet until we get it in. But I'm thinking just an estimate, and when I get the report, which I'll get tomorrow, and I'll be happy to share it with you tomorrow. I'm thinking around about 900,000 for a pay period of 2 weeks.
Is this retroactive or
no? This is from the date of the differential pay was authorized by the executive order.
May 5th? Or wait, no.
No. It's April 10th. April 10th.
April 10th.
And it's not going to be retroactive, right? Prior to
that was the subject. If you recall, that was the subject. There was a bill in the legislature to make it retrospective, and that got expanded into other areas.
Right.
And for that reason, the governor vetoed the bill and submitted a bill to simplify the whole thing into authorizing the retrospective payment. But I don't believe the legislature has acted on that as of yet.
And so this is Category 1, 25% pay differential to essential employees, right?
Yes.
Okay. In the course of their duties who are in direct contact or in close physical proximity to a population infected with COVID-19. Then Category 2 is the 15%, and Category 1 is the 10%.
So
this go ahead.
Category 3 is 10%.
Right. So we had asked John Jr. Calvo, and maybe you know a little bit more about the application of these different sliding scales, but the question we had posed was, would employees like Alice Tyron or Rebecca Respicio, who are staffing the Pacific Star Quarantine Hotel, would they get the same amount of COVID differential pay as, let's say, a medic with Guam Fire who's transporting PUIs, or someone at GMH who's taking care of COVID positive patients, or someone at public health who's swabbing for community testing?
Well, I'm not familiar with exactly what they're doing, but if they experience a similar type of exposure, then, if you recall, cabinet members are entitled to Category 1 or Category 2 pay, but not Category 3 pay. So I honestly don't know what they're doing because, as I say, we're getting all these timesheets in. I will take a look at their timesheets when it comes in, and if they're reporting that they had a similar exposure, they would get the Category K in the appropriate category.
Just for clarification, so the governor signed another executive order to allow for cabinet members to be eligible for this COVID-19 response differential pay.
It was included in the executive order.
Right.
And in the initial one.
They were only entitled to a differential pay in categories 1 and 2, but not in 3.
And 3 is
Category 3 is a 10%.
Yes.
Oh.
So they're eligible for the higher differential pay.
Obviously, if their exposure so warrants. Right. For me, I don't have the exposure, so I would normally be in the 10% category, but because I am, I don't get any differential
I see. So who makes the final determination? So if, let's say, Alice and Becky send in their timesheet to you, and they say, we got towels for a guy who stays down the hall from a guy who's COVID positive or whatever. I mean, is that your call to look at it and say, yeah, you're going to get 25%? Or, I mean, whose call is the onus on the person who submits the timesheet and the request?
Yeah, I mean, that would be true, Chris, of any timesheet. Is the primary responsibility of an employee is to report their time accurately to their supervisor.
But they don't get a timesheet because they're on salary. They're unclassified, right?
No, but we do have. I have a timesheet.
Okay.
And these duties are being reported on special timesheets that we're using to aggregate the differential pay. Ultimately, cabinet members' time. My timesheet is authorized by the chief of staff, or in this case.
So, in your opinion, if a director of a government agency works at let's say, a government of Guam quarantine/isolation facility where there are people who are COVID-19 positive, do you think that working in that facility allows them to receive the highest or the second highest COVID differential pay?
Yes, I mean, if they're exposed to people, I think there's a difference between an isolation facility and a quarantine facility. Because isolation is people who haven't tested positive.
Right.
But quarantine is people that have tested positive. And were they in that category? Yes, they would be entitled to it. That's the whole purpose of the differential pay.
Right. So what if they're just manning a quarantine facility that doesn't have the isolation component with the COVID-19 positive patients?
Well, that would depend on the circumstances. I would have to look and see, were there any positive people that subsequently tested positive in that, because when you go in, you could test negative, and sometime and that's the point of isolation, right? Sometime during that isolation period, you could test positive. So I'd have to look at all those circumstances.
Right.
And obviously, in this case, because of the info that you're sharing, I will look into it when I've got all the information.
Right.
Are you going to be getting Category 1 or Category 2 COVID-19 response differential pay?
Am I?
Yeah.
No. No, I just said. That I would normally be in Category 3, and Category 3 is it does not qualify.
Right. Yeah.
Whose positions do not allow them to telework.
So basically, Mr. Byrne is working during the pandemic, but he's not coming into contact, not being exposed to COVID-19 positive patients. So you would normally qualify for the bottom tier of the sliding scale, but the governor's executive order exempts cabinet from qualifying for that. Correct?
That's correct.
Okay.
That's absolutely correct. Yes, and that's I'm talking to you sitting in my car, so I can talk to you without my mask on, so that you can hear me.
Can I ask you if this new COVID-19 response differential pay policy If it was not enacted through executive order, or if this didn't even, we just came up with this plan, if we didn't have this, would people that were eligible for differential pay, the double pay, would they have gotten paid the double pay?
Well, it's circumstances rather than the differential that led the Department of Administration to conclude that they shouldn't get double pay. The governor felt, and that seems to be reasonable, that people that have an exposure should be permitted and rewarded for submitting themselves to that exposure. But as I said right at the very beginning, none of the circumstances entitle them to double pay. So this scheme of differential pay, which was meant to respond to the differing risk to those employees, was devised and implemented.
What about
But if the government is shut down, isn't it only essential employees supposed to be working? And hence they would be eligible for the double pay?
No, but as I said at the very beginning, the circumstances of that 8.406 just don't apply, so that rule doesn't apply. So we had to devise some other way of rewarding the government workers that are working for the risk that they're taking.
What about Homeland Security personnel? Do they get the sliding differential? Would it be maybe the third tier?
Well, again, it depends upon what they're doing, and I'm sure some are involved in dealing. One of the questions I'm going to have to deal with is the bus drivers that take people from the airport to the quarantine facilities. Are they exposed and aren't they exposed? And that's a matter of fact and circumstance. And we'd have to look at everybody that works, even at Homeland Security.
Right. And then, Mr. Byrne, there was a comment here, and I'm going to send a FOIA. I think I did send one. Will this be public knowledge as to who did what and got what category pay?
All government remuneration and compensation is published, and yes, it will.
Yeah.
Okay. So it's up to the directors to determine who gets category 1, category 2, category 3?
Well, the directors know best what's going on in their own agency.
Right, but they're the ones who decide.
Yes.
Okay. And so this 8.406, this is the natural disasters and emergency conditions. Is that what you were referring to?
Yes.
Okay.
Yes. I can see that is necessary in there would be another unfortunate circumstance, but in a short, sharp incident like a typhoon, where we do close down all the government offices. But the very people that the senator's letter said should be paid this double pay are the very people that are working in the agencies that are operating. So it's really is a contradiction of that rule.
Is there a specific law?
But aren't they working because they're essential?
Yes.
Yeah. Okay.
But that's what they're doing. But the facility isn't closed. The facility is open. They're not out. Some of them are out doing things, but some of them are working in the facility, which for an essential service is open. And the Department of Administration has some essential services going on, and we've remained open so that people could get paid and vendors could get paid.
What about nurses who work for public health who report to DAZN or PACSTAR? Are they reporting for regular work? And then also, Mr. Byrne, is there a specific law that authorizes the executive order for COVID differential?
No, there's no law. It's an executive order.
Right.
So you wouldn't need an executive order if there's a law. I honestly, because I don't know about those nurses. I would have to look at the specific timesheets. And the nurses are coming from many agencies. They're coming from public health. They're coming from GCC. They're
GDOE, UOG, right?
And UOG, and some from GRMC. So I really couldn't tell you. But when we get all this information together, I think we'll be able to dissect it to your satisfaction.
Right.
Did you get a legal opinion on this whole double pay issue?
I haven't got a legal opinion. No.
That was
A
just
copy
based
of
on your interpretation of, okay.
Yes, but a copy of the letter went to the Attorney General, but I haven't heard anything in response to it.
Okay. I was just wondering if the decision based on we're not going to pay out the double pay because of Section 8.406 doesn't apply here was based on any sort of legal advice.
I mean, it's kind of a...
Because GFT has indicated that, there's a possibility that this will go...
To court.
To court.
Yeah.
I'm sure, of course.
Yeah.
And what I suspect that whatever we did, it would go to court in some fashion, since that's, the ultimate place for testing these rules and laws.
Right.
And that's the purpose of courts, right?
Yeah. I'm just saying,
Yeah.
I kind of just wanted to know if there was any sort of legal advice provided. So, because we have somebody providing all kinds of legal advice in what we're doing today.
Right.
Well, yes, and we get legal advice from lawyers, non-lawyers, with
no shortage of legal advice, Mr. Byrne.
There's no shortage of advice and opinions around.
Yeah, you're right. Yeah.
I assure you, we take notice of them all.
Someone wanted me to ask if you're related to that lady from Guam Business Journal.
No.
Okay.
Not to my knowledge.
Right.
No. I don't think honestly, I don't think I'm related to anybody here.
Okay.
Of all the people that I could have married, I couldn't find someone further away from being related to, I don't think.
If I talk like this, can we be related?
Yeah. Can we get information if we talk like this?
Well, I'd have to see how you held your teacup.
Pinky up, I guess. Yeah. All right, Mr. Byrne. Thank you for your time.
Thank you so much.
Yeah.
Have a great
Keep
day.
safe and have a good day.
Yeah, and wash your hands. Okay.
I'm going to. Thanks.
Okay. 8:27. Let's do a deep dive into the day's COVID-19 headlines. We also have Lester Carlson from BBMR calling into the show. And then we're going to get Senator Amanda Shelton, 9 o'clock. Was up front with her and said, hey, call in and tell us why you voted no on the override of Bill 333. They kept saying Bill 33 yesterday in session. So let's do it.
Bill 333.
Right. From the KUAM News team with the latest in your COVID-19 headlines. Good morning, Sabrina Salas-Mantanani.
Off today, everybody. Here's the latest from the Joint Information Center, released at 11 o'clock last night. On Tuesday, 70 individuals were tested and 0 tested positive. This means that the number of confirmed cases of COVID-19 on Guam remains at 149. 7 who retested positive after initially recovered. I need to rework that. 7 retested positive after they recovered. So to date, there's 124 recoveries and 5 deaths. During her press briefing on Tuesday, Governor Lulian Guerrero signed an executive order creating the Procurement Salapi Adzudan Itautau. It is a disaster relief program. Anywhere between $300 to $1,200 in emergency assistance for as many as 18,000 local families could be sent out as early as Friday. The direct disaster aid program that will be paid for by $20 million from the more than $117 million in federal disaster assistance that the governor recently received as part of the CARES Act. Public Health will distribute the money to those who already qualify for programs like SNAP or Medicaid. Those who are within a certain threshold of the national poverty level can also qualify. For example, a household of 5 that makes no more than $4,400 a month. You can check Public Health's website for the chart, and you have until May 14th to apply. The governor also said she expects to reopen certain businesses by May 11th. Public Health will be releasing an advisory shortly for which industries will be allowed to reopen, and businesses within those industries will have to agree to certain health and safety guidelines. The governor also announced plans for $20 million in direct grants for business interruption losses. GITA is coming up with guidelines for which businesses can qualify. An announcement about that will also be made soon. The governor, in the meantime, says she understands the public is suffering and angry, and she is too.
Waited too long. Do you feel you waited too long and maybe underestimated the level of financial anxiety that families were feeling, and then the resulting anger? Did you wait too long for this?
I think it has been too long, but it's not because of my control. It is first federal control, and also we did not get this 117 million till about maybe a week ago or 2 weeks ago, and we could not use this money until we got the guidance and the advisory guidance on how we are to spend it. It's money, Nestor, that although it's under my authority, but it's not like I could just use it right away. And so the delay in pushing this money out is because we had to abide by federal guidelines and advice, and we didn't get it till I think about a week ago. And I just, for whatever it's worth, the other states also were just as frustrated and just as upset about the delay in trying to move this forward. So as soon as we got the advice, we started creating this program, and so now we have it out. I am very angry that our people had to wait this long, and I am very upset. And I have said this in the past, and I have done within my legal authority, within the regulations, within what I can humanly possibly do to try and push this out. So good things have happened this week. We've got the notice that our implementation plan for the economic impact recovery has been approved, and we're looking at pushing out that money as soon as we get it. And excuse me, we're probably going to be able to do that within the next 2 weeks. Additionally, we are also excited that our implementation plan for the pandemic unemployment program has been submitted, and they've received it. We also received the federal pandemic unemployment compensation agreement, and we are in discussions with the Department of Labor to get that program going. In the meantime, what we have done here is we have prepared our processes so that once we get the monies and once we get the okays and the approvals, we can push them out as soon as we can. So if it's anything that I can do, I will certainly do it with the best of my ability. I know people out there have been very upset. They have been very very scared. They it's like they have nowhere to go but to rely and wait for this. And again, the delay is something that i I have not in any way intended to do. It is certainly, like I said, I was very angry, upset, frustrated about the delay.
Of Order 2020-13 establishing the COVID-19 Pandemic Recovery Office, which will be responsible for working with FEMA and will be authorized to provide information, assurances, requests, or justifications on her behalf. The Recovery Office will also support the work of a recovery panel of advisors. Her order also implements transparency initiatives, including that all FOIA requests and responses related to the emergency to executive branch line agencies be submitted to the AG's office for posting on its website. Additionally, COVID expenditure reports will be submitted to the Guam legislature to also post on its website. And finally, her executive order mandates that while the Guam Office of Public Accountability will conduct an audit of all spending under CARES Act, she will have a third party conduct a review. The governor, meanwhile, apologized for what happened during last week's press conference.
Support the decision to censor the media and the action by your communications director, Janella, to press mute on our questions at last. Do you still stand by your legal counsel? Did you support the decision to censor the media and the action by your communications director, Janella, to press mute on our questions at last Thursday's press conference? And do you also plan to issue an apology at all for not answering the media, more so the people?
So let me just say, Adriana, that I give great respect for my director of communications and policy for being very forthright in apologizing. I also have great respect for the lieutenant governor and very forthright in apologizing. There was no intention of censorship at all. There was no intention of censorship. The fact that it was muted because I know the guidelines were certain guidelines and it wasn't being followed. And that's it is what it is, and people have apologized. And so I am going to be together with great respect, honesty, truth. Yes, I apologize for the mistake that happened. People make mistakes, government makes mistakes, but I am not ashamed to say.
Asked the Magahaga if she thought the way her son-in-law and legal counsel Hyun handled procurement of hotels as quarantine facilities, isolation facilities, would hold up to FEMA reimbursement standards. There are no contracts in place for those facilities, and FEMA has told KUAM they haven't received any paperwork on the procuring of hotels.
Do you still stand by your legal counsel's handling of this procurement, and do you believe it will stand up to federal scrutiny for reimbursement?
So I just want to also start off by saying this COVID crisis has been a very unprecedented event. This kind of emergency has never been experienced by anyone here and also by anyone globally or even nationally. We have heard many messages from all over saying that this emergency is really a very serious kind of virus disease. And in saying that, when we got our 3 contact COVID positives, we quickly and expeditiously and aggressively put in measures to try and contain this virus. Why? Because we want to save the lives of our people and we want to contain this virus. So, in the issues of procurement, when I declared a public health emergency under the Public Health Act that was passed by the legislature, when I declared that, that gave me some powers to quickly act and to quickly make decisions and to quickly get the resources that I need in order to save the lives of our people. One of that is suspending rules and regulations, which also related and applied to procurement. So when we got these contact people and public health wanted to do a quarantine of all people coming in, we went forward and got the facilities. The way that we handled this procurement and the way that we used our emergency powers are within the law as stated. I truly, fully believe that the legal counsel and the legal team acted appropriately. They acted within the bounds of the law and they acted quickly to help in helping the community contain this virus. So yes, I stand behind my legal counsel's actions.
Okay, and for a follow-up then, so the pandemic response plan assigns GHS and the Office of Civil Defense to handle procurement. So why did you feel it was necessary for your legal counsel to handle negotiations for quarantine isolation facilities? And what else is being negotiated on behalf of the government in response to COVID-19?
So I directed my legal counsel to quickly handle this situation. And yes, once contracts are signed, once agreements are made, they go through FEMA. And when we decided to go out forward, we decided that we wanted to work quickly, like I said, and we worked with GHRA. So FEMA is put in the loop. We give all the information to FEMA. And there were discussions with FEMA about this facility. There were discussions with the Homeland Security, so FEMA was aware of what we were doing.
The governor offered her version of events regarding the use of Public Health Director Linda DeNorcy's digital signature. DeNorcy said her electronic signature was used without her permission on documents relative to negotiations for the use of the Pacific Star Hotel for a GovGuam quarantine hotel. The governor saying, quote, "It was a letter read over the telephone and her permission was asked and she gave and authorized her permission to that particular letter." Now, she did say to me she does not remember and she does not recall. Can be also plausible because as Linda is the director of public health and there's many things coming her way, many decisions she has to make, I can agree that she does not recall and she does not remember, end quote. KUAM spoke with DeNorcy late Monday afternoon and she told us she stands by statements made to the media. The legislature has voted to override the governor's veto of Senator Therese Terlahi's transparency bill, or Bill 333. The bill was passed unanimously by lawmakers about 2 weeks ago. It now requires Adelud to provide a report to the legislature of all COVID-19 related expenses. The vote was 14-1, with only Senator Amanda Shelton voting against it. The governor, in her veto message, stated placing additional requirements on the use of these funds is an overreach of legislative authority. Here's more from session floor.
We must have faith that we will achieve this transparency. We as a body can take the reins of leadership by
landslide 15-0. What has changed since the veto by the governor? The only thing I can see is that this bill should have been passed because transparency has not been clear at all since the time we passed this as a body in our last session. In fact, the water even got more murkier with transparency, and the pool is even greener than ever before. I can't even see through it. I can't see my fingers anymore. What has changed is that I've been hearing about the media reports of so many different things that the people are frustrated and wondering, how can this all happen? It's questionable contracts, it's questionable transactions, from the 19th floor to the first floor and to the lobby, all the way down to the parking lot. It is our obligation to effectuate the checks and balances as a legislature body. It is not to point fingers. It is to be the eyes on the checkbook for the people of Guam and their taxpayers' money. And if things are run right, then we can stamp our approval on that. If things are run improperly, then we need to fix it. But we won't know unless we're transparent. And have we been seeing transparency? No.
Here's Senator Amanda Shelton, who again voted against the override.
We must have faith that we will achieve this transparency. We as a body can take the reins of leadership by not overriding the veto. We can trust the administration also recognizes the need for transparency, and we must have faith that this will be achieved. Madam Speaker, I know that on Saturday, thousands of our people across the island felt what I was feeling, a renewed sense of faith and hope, seeing the love of God through the visit of Santa Maria Camalin throughout our villages. God, through the intercession of Our Lady, renewed our hope and faith. So let's build on this faith. Madam Speaker, overriding this veto is not an act of faith. It further strains how our branches will deal with each other. This is not anaphemalic. This is the antithesis of anaphemalic. It is the opposite of what we are called to do as island leaders.
Masi Legislative Secretary, Senator Regine Biscoli, I will acknowledge you on this veto.
Madam Speaker, just a request.
It has been almost 3 weeks since all 15 members of this legislature united together to pass Bill 333 in a demand for increased transparency and accountability. This bill could have been signed on that day by the governor, but instead we are here weeks later to override the governor's veto and ensure that we receive timely reporting of expenditures, copies of agreements with the federal government, and swift implementation of these relief programs. Valuable time has been lost. In the governor's veto letter, she outlined several reasons the bill was vetoed. The first reason stated, and I quote, "A local statute commanding the executive branch to do what federal law already prescribes should not confuse these processes," unquote. I would argue that nothing in this bill confuses the administration's processes. What the bill does is requires the government of Guam to provide copies of agreements between government of Guam and the federal government. And while the administration is accountable to the federal government in relation to the stimulus funds, this administration and GovGuam agencies and employees are equally accountable to the people.
And finally, in your Banking 671 report brought to you by Coast 360 and Bank of Guam, Coast 360 announces that effective today, it will reopen all of its lobbies for teller services and scheduled appointments. Member center hours will be Monday through Friday from 9 a.m. to 2 p.m. The credit union, however, remains closed on Saturdays at this time. Please note that you must wear a mask for entry, and while they plan to reopen, members are still encouraged to take advantage of alternate and electronic banking channels to continue to support stay-at-home efforts and limit in-person contact. And that's your Banking 671 report, sponsored by Bank of Guam and Coast 360.
Hey, and the Containing COVID Multimedia Broadcast Extravaganza, proudly brought to you by IT&E, Ambrose Inc., and Calvo Enterprises. It is 8:46. We're going to hit the NMI with Tomas Maglotnia coming up in just a little bit, but he's the head of the Bureau of Budget Management and Research, Mr. Lester Carlson. Bring him on to the show here. Good morning, Lester.
Good morning, Chris. Good morning, Sabrina.
Hi, Lester. I wanted to talk about your the plan, the budget breakdown that was submitted to the Guam legislature for the $117.9 million in CARES Act funding, and how, I guess, it was put together. Was it based on input from government agencies on their needs and their expenditures in response to COVID?
Yes. Do you and Chris have a copy of the Coronavirus Relief Fund guidance memo from
the U.S. Treasury?
Yeah.
Yes, I can pull it up.
Right. What we did was we reached out to all the departments and agencies, including the autonomous agencies, GCC, UOG, and the Port Authority, everybody, and we attached the guidance, making it very clear that any expenditures that were not part of your budget and were due to the public health emergency brought upon by the pandemic may be eligible for some of this funding, and there's like 6 categories. So our budget is sequentially structured to run parallel with the guidance memo. So if you look at things under item number 1, which are eligible expenditures include but are not limited to payment for, and then number 1 is medical expenses, and there's a whole bunch of bullets there. Then number 2 is public health expenses. Then number 3 is payroll expenses. And number 4 is expenses of actions to facilitate compliance with COVID-19 related public health measures, such as, and there's a bunch of stuff there. And number 5 is expenses associated with the provision of economic support in conjunction with COVID-19 public health emergency. And finally, number 6 is any other COVID-19 related expenses reasonably necessary to the function of government that satisfy the fund's eligibility criteria. So we made sure that people understood the onset of the public health emergency was when the governor issued her executive order 2020-03 on March 14th, which is a Saturday, so kind of really went into effect Monday, March 16th. And that they had to have expenses that were corona related that weren't part of their budget, and submit those to us. And we received some expenses. We made some adjustments to be in line. We tried to be in line with people who are looking at Zoom capabilities, and there was one agency that had rather large number for Zoom capabilities, so we reduced that number in line with other agency requests for Zoom, so that you wouldn't see something that was glaring.
Mm-hmm.
And it's kind of funny because did you guys listen to the press conference yesterday?
Yeah.
Yeah, so Patty Arroyo said, hey, what's this about a $895 laptop bag?
Yeah, I saw that. Mm-hmm.
And she was, I said, well, it's the utilization of the fund for the activity. I won't sign off on an $895 computer bag. And she was, but it was under BBMR. So yeah, what happened was
See, what had happened was.
Yeah, see what happened was we forgot the S. So it's 10 computer bags to be, for the telework thing. We're actually doing that we're trying to do it from here. The agencies don't come into us anymore.
Right.
So they send their stuff electronically, but we don't have the capability to do that from home in an efficient manner. So
Right.
we're gearing up for the new norm. And sorry, Larry, I didn't put the S.
Yeah. There was something else here under BBMR, Lester, that was, you got that?
No, I was looking at the Hagåtña Redevelopment, Restoration and Redevelopment Authority for iPads, laptops, hard drives, network, storage.
I wanted to ask.
And the library, Guam Public Library system on there. There's just a lot on agencies I hadn't even thought of, like Civil Service Commission for Smart TV.
Let me touch on the Civil Service Commission.
Okay.
Have you ever been to a civil service hearing?
Right. Yeah, of course.
Oh my God, it's like pulling 8 of my teeth. So you have several cases that are being heard, and they don't. I mean, it's a time-consuming effort. They're migrating into being able to do these things electronically. They don't have any capabilities. Same thing with HRRA. They're currently housed at GITA, and they avail themselves to the equipment and facilities at GITA, but they need to be able to be self-sufficient. And everybody really should be looking at being able to have this telework ability. And that's where you see a lot.
And so when people look at this, Lester, and they're like, oh my God, $5 million in laptops or whatever, the flat screen TV, all of this is being purchased to, I'm assuming, to do that telework, to do the Zoom, to do the social distancing. But is all this,
Is this essential? That's what I'm wondering. Like the Guam Public Library system, do we really need them up and functioning?
Well, the new norm is going to be that we first and foremost, I would love to see a renaissance into the use of the library. Okay,
Mm-hmm.
I really, really would. I remember that was when after school, if you wanted to hang out, there was a couple places to go meet other people that were just out of school too, and one of the places was a library. And if you were going to go see somebody, a library was always a safe place to do it. It was like neutral ground.
Yeah, it was a hookup spot.
Yeah, but I wouldn't want my son going to the library during these
Lester,
times.
what about this BBMR $11,432 office reconfiguration to accommodate COVID policies?
Oh, you're going to be proud when you see that. You're going to be happy. We cannot and should not, and this goes for everybody, not just government but private sector. We are minimizing contact with people. When we do open our doors, there will be a area in which a customer will come in, and there'll be a separation from our people and their people. There'll be a plexiglass window with trays outside, and the whole idea is to minimize social interaction and to try to prevent as much as possible people coming in and coughing all over our staff. So the configuration, you're going to see a lot of that everywhere. Everybody, look at Payless, you look at Benson, everybody's got some kind of barrier up to minimize the contagion and the transmission of it. So we're doing the same thing. I need to protect my people. They're on a normal basis, Chris and Sabrina, there's a lot of people dropping stuff off here, left and right. Sometimes, the messengers will be coming back like 3 times a day from public health.
Yeah.
Okay, public health, right? Who touched those documents, right? I mean, this is the new way of thinking. I don't know who touched what, and all of a sudden that stuff comes over here. So the migration to the increased use of electronic communication and working to satisfy agency needs is working on our end, but that means we have to come into the office. We'd like to be able to have that, God forbid, should things get, that second wave come in or something like that. It's like the story in the Bible where the ladies are waiting for the groom to come over and they run out, the younger ones run out of oil, but the older ones save some oil. Well, I'd like to have some oil.
Right. Yeah, but I mean, what is your, I guess, reaction to people who may say, like, why are we buying and giving money to, like, the Hagåtña Redevelopment and Restoration Redevelopment Authority when perhaps it could go to, agencies like more money being given to health and safety?
Right.
Well, number one, there's a criteria issue. Okay, so health and safety are very well taken care of. There's patrol cars, there's fire trucks, it's
an ambulance.
Yeah, I mean, so we are taking care of public safety. We are taking care of public health. We do need to never lose sight. I mean, when we open up, I don't want to look down and the future is right there in front of my feet. I want to have my head looking at the horizon. And HRRA, yes, it's a visionary type of agency, but they're supposed to be the vehicle from which our capital is master planned and redeveloped. And we shouldn't ever lose sight of maintaining that vision. Let's make the most of
But if it's such a visionary office, there's only 2 people working in there?
Yeah.
Maybe 4.
I mean, but what's the stop? I mean, if I'm in a government agency and this is a hypothetical, and I see, wow, we can get a bunch of laptops, we can get some TVs, it's all covered with the federal funds. Let's go. What's to stop people from just buying all kinds of laptops, buying all, because it kind of looks like, I mean, I'm not saying that's what's being done, and I understand that we're making this move to telework, but who is it you, or are you the one who says, hey, wait a minute, that's not, no?
There's a bunch of stuff I cut out primarily because it didn't meet the criteria. Right. So what is presented is what it was that we thought was appropriate. There are several agencies that are quote-unquote not essential, so they're not reporting to work, but that doesn't mean that they shouldn't have the capabilities to telework. So, just because somebody is a non-essential, an employee of a non-essential agency doesn't mean that, we shouldn't lean on them for something and be able to communicate with them effectively to be able to continue to, move forward.
What about this report? This is going to be something that you guys routinely submit to the legislature?
Yeah, I think that recovery office portion, the repository collection stuff that I think Ricky Hernandez is going to be heading up. I think that's going to be, everything's going to funnel through for Ricky, and that'll be the vehicle for everybody to take a look at how things are done. And we will be very mindful of adherence to what it is that has been, again, it's a budget, it's a plan. When the details start coming in, we'll be very mindful of making sure that people aren't wandering. And as the governor mentioned yesterday, if we see a need that we missed, and nobody's perfect, I forgot the S after all, and I got called out yesterday. So
I better not see you with like a Gucci Louis Vuitton laptop bag.
Hey, you know what?
I mean, you don't really seem like the type, but I'll know. I know an $895 laptop bag when I see one.
Yeah, well, I wouldn't. So thanks.
Right.
We drink the same beer, so that's a good thing.
I wanted to ask about this Department Administration 9.5 million credit card fees borne on the government of Guam as part of the team plan, the 3.5 million?
Yeah, I spoke about that actually twice yesterday.
Mm-hmm.
If you, Sabrina, are paying a bill, a government bill, and you wanted to use a credit card, you were lining up at, back in the day, right, over at RevTax, Treasurer Guam.
Mm-hmm.
You're renewing your vehicle registration, right? Say it was, it was $100, but you were to use your credit card, you were charged a convenience fee, and that convenience fee might have drove it to like $104, $105.
Right.
But you had to eat the convenience fee. So understanding the economic impact on all of Guam, particularly the service industry, one of the very first things that we did was we said, okay, fine, we will eat the convenience fee. Well, let's allow people, because we're social distancing and we're asking people to stay home, to use their credit card, pay their bills electronically, not get in their car, not drive around, and we will eat that fee. So we estimate that cost to be $3.5 million. So what used to be borne on the customer and the taxpayer, we're picking up because we just thought that it was an appropriate thing to do. But it also continues. All of these things sequentially and collectively, are all designed to get us to be more electronic minded, use technology.
Yeah.
And we're saving people a couple of dollars here and there.
Yeah. Okay. Lester, what's missing here is who you guys are buying the stuff from. But
that's all going to be RFP.
Okay.
We're not going to rush into stuff, and we're not. We'll get the bids and things of that nature. We have till December to spend the money, so there's no reason why we can't give the agencies the ability to provide the spending plan and request for the issuance of a requisition. Upon the approval of a requisition, it turns into a purchase order. It's given to the vendor, and then the vendor provides, and after the vendor provides, then the vendor gets paid. So, we'll be back to that situation.
Back to following procurement laws?
Yeah.
Oh, okay.
Hey, Lester.
I wanted to ask, so you have, I'm just going through the expenditures, COVID-related medical expenses, and there's $7 million for American Medical Center, FHP, SDA, and the governor kind of touched on it yesterday about the cures tier plan. So we don't know right now who's getting paid what, right?
No.
So how does that work? Because I noticed that Speaker Tina Bounier-Barnes earlier this week, she said that there was no MOU that was provided to these clinics from the governor's office, and they were still waiting. But from what I understood, an attorney turned in MOU to the governor because they had been waiting.
Oh, I don't know.
Okay. So how do you determine who gets paid what? It's just based on the cost that they incurred as serving as this.
I understand as much as you understand with respect to the need to have these facilities as part of the cures approach to addressing the pandemic. The amount that is set there was there. When I am aware of the compensation breakdown and what the billings are going to be, then I can let you know. But I don't have that. I think the idea was that we know that we're going to be incurring a cost for the utilization of those 3 clinics, and that those 3 clinics are due compensation. So
okay,
if it's nominal, right? If it turns out to be nominal, like the question came up about GRMC.
How is that going to work out?
Well, we're not paying them, but they're part of the whole network.
The cures.
Yes, but the thing about it is, GRMC is providing services that ordinarily, because they're a private hospital, GMH would do. So they're helping with what's going on. And if you've got insurance coverage, well, you normally wouldn't go there, but they're accepting, people over there. So they're charging. So, I mean, there's no need to pay them because if they're MIP or Medicaid, that's covered under that. If like me, under GovGuam with Aetna, if I presented myself there because GMH wasn't the place I was supposed to go to present myself because of how things are structured, then GRMC is providing part of the network for public health, and I mean they're not going to do it for free.
Right. Yeah.
So there may be some costs for GRMC as the non-COVID
There may be
hospital.
some additional income generated by us for utilizing their facility
Right.
that they ordinarily wouldn't do.
Mhm.
So think about it from that perspective.
No, I understand. What about this temporary hospital program for COVID-related expenses? $3 million. What is that?
So we put together like $7 million.
Right. So there's 3 million temporary hospital, 4 million quarantine facilities.
Yeah. So when we established the account, right, there in the account it says temporary hospital, but when you go to the exhibit that is attached to it, there's a more broad application. That was my catch-all for expenses for PPEs and for other requirements to stand up. There was money spent at Paseo. I authorized money to come from that $3 million account. It's like $35,000. I don't know if they used it all for the renovation of the
Safe
bathrooms.
Haven, which ended up not even. I mean, they're not going to use Paseo anymore.
Well, we got renovated bathrooms. So
Right. Hey, Lester, there's a comment here from Ryan. He comments, I just renewed my vehicle online and still had to pay the credit card convenience fee. Can you ask Lester if I will be reimbursed?
Ask Ryan to send me the information. I will follow up with him. This program has been in place for a while.
Yeah.
There should not have been a fee assessed to him.
And so that's still in effect, right? Because I remember that at the start of COVID, the team, you guys said, hey, here's what we're doing.
Yep.
And so does that just does that $3.5 million, does that go to just whatever bank you guys, the people who with the credit cards bank with?
Yes.
Okay. Hey, and then Lester, I guess I had another question. Is this a budget or is it an expenditure report, or is both?
It's a budget, Chris and Sabrina, is a proposal.
Right.
When you look at
So has any of this money been already spent?
a little bit of it. There's
Okay.
the stuff that we incurred when we were using the catch-all $3 million account for PPEs and the Paseo renovation. We JV'd all of that stuff from general fund agencies that the governor exercised her transfer authority to actually have $4 million for quarantine facilities, $3 million for the catch-all, right, including the temporary hospital. And now we restored the allocations that we took from the general fund agencies last week, and now we're transferring all the expenses to this account.
What can you tell us about the disinfecting and the cleaning? Do you know what company that was?
Which company and what? I mean, there's a lot of disinfecting and cleaning.
Yeah,
Everything is being disinfected, which is a good thing.
Yeah, I mean, there's a lot of cleaning.
I'll get the specific. I'll shoot you a message later.
Okay,
Yeah.
no problem.
I did want to ask, I know we've been asking about this whole double pay issue, and it was brought to our attention that, autonomous agencies are paying, I'm not sure which ones, but we understand that some autonomous agencies are paying this double pay, but the line agencies aren't. And so I'm just kind of wondering, what's the difference?
That's an Edward Byrne question.
Okay. Edward Byrne.
Edward Byrne.
Yeah, if I had recalled that, I would have asked him that.
Right.
But just on its face, it doesn't seem like it would be fair.
GWA in particular was emailing myself and Mr. Byrne 2-3 times a week, and looking for guidance because they adopted more or less DOA's personnel rules and regulations. So that section on the double pay, it's there. And they were looking for guidance because, they were trying to figure out, well, what are we going to do? And we hadn't issued the executive order basically implementing the hazardous pay for government of Guam. We then did that, and we are guided now by the hazardous pay differential. What other people do who are outside of the governor's purview, autonomous agencies, the university, GCC, the courts, the legislature, we have no authority over what they do with the funding that they have. So if somebody's doing something different than the government of Guam, and they have the prerequisite authority to do so, and more importantly, they have the funding to do it, then we just can't afford it. I'll just be straight up. You're right. It's not fair. I can understand that completely from a Budweiser drinker standpoint, but at the end of the day, it's like, well, you can do that, but I'm not going to advocate or endorse. As a matter of fact, I will oppose it. The differential hazardous pay, we can handle that, and it is an allowable expense under the coronavirus relief fund.
Hey, what do you think of this comment here we had, Lester? Why can't civil service and other agencies like HRRA take their computers and their TVs out of their regular budget and save the CARES money for essential emergency needs?
Okay, so Chris, you're doing me a really good favor because you're giving me these easy questions. The criteria for use of this money is that it could not have been in your budget. And that these costs were outside of your budget.
Right.
Yeah. So there wasn't anything budgeted in these agencies to be able to do this transitional, move. Hence, we thought it was an eligible expense.
Got it.
So they could, when you say transitional moves, you mean to teleworking?
Yes, I'm not an alarmist. Okay, the governor is always being careful to tell everybody that hey, heads up. They're talking about a second wave. I'm coronaed out. I'll tell you this. I'm glad I drink Bud because I'm coronaed out. I'm seriously, I am. And the thing about it is, I saw something. And I don't read this much because it just kind of like, you read something like, oh crap, and it's like there's a strain of the coronavirus now that is more dominant and more infectious. I mean, I don't want to hear this stuff, but it's out there, and the governor's being extremely careful. And I understand that like beaches got open in California and Florida, and then next the infection rate went up, so they closed the beaches again. So it's like we tried, but everybody started like going out there and interacting and forgetting about being responsible. So we just need to stay the course and try to understand that we're probably going to be using this as a great learning opportunity for how we get things done. But more importantly, let's not lose sight of where we want to be. Not I just got off my butt and I'm happy to stand. I want to walk, and then I want to run after that.
Yeah, and I get that. I think maybe because if we are going to move toward this teleworking and we're preparing for what may or may not be a surge in the fall, I just didn't see HRA as one of those priorities. Maybe like Parks and Recs getting funding, or Department of Land Management, or CLTC, I just figured those would be more of a priority than.
I mean, maybe they just figured that we can get these
or
laptops
the Guam library system,
and we can get these TVs, and it's covered. So, I mean, this is a working document, right, Lester? I'm pretty sure we're going to see. I'm just thinking all the agency heads now are like, "Oh, let's go get some laptops."
Right. Well, when you dropped this to the legislature, have any of them called and said, "Whoa"?
Well, what I did yesterday.
Whoa!
I was under the gun to get this thing done, and it was finally approved yesterday around 9:30. So Jason Baza from my office made some changes on the spreadsheet consistent with the governor's final directions. And then we had a cover letter developed, and then I had the governor sign it, and
boom.
I dropped it off directly to the speaker and to Joe St. Augustine. So they got it maybe about a little after 11 yesterday. Have either of them called me to discuss anything? Not personally. They probably they might be communicating with the governor, but nobody's called me.
Okay. Okay, Lester, we got to run. We got Senator Shelton on the line, so want to get to her. But
hey, don't forget to wish her a happy belated birthday.
Right, yeah. Okay.
Thank you. Go drink your Budweiser. Have a great day.
Wash your hands.
After my bud.
Okay, fine.
Take care.
Bye. 9:15. Yeah, let's get Senator Amanda Shelton on the line
He
here.
must have said that like 3 times.
Yeah.
I get it.
Oh, well, we are sponsored by Ambrose. So. Senator Shelton, happy belated birthday.
Hey, thank you very much, Chris.
Happy belated birthday.
Thanks, Bree. Thank you.
Wow, so you kind of stuck out yesterday in session.
A little bit, I guess.
I mean, you you took the floor. You made your stand. And what do you want to reiterate here on the radio show about why you were the only senator?
No. I know what you want to ask. So what did Regine say to you?
Yeah, that's what, can we just start with that? What happened there? Because I'm sure you saw there's a thing on Facebook with an overdub, but I was able to zoom into and there definitely was some type of exchange between Senator Regine Bisco-Lee, yourself. I also saw Senator Kelly Marsh Titano. Can you just please tell us what that was about?
Sure. Well, as you know, when we go into recesses, we talk about all different things, sometimes related to the bill. And I guess they were just a little surprised that I took that stance because I didn't share it with anyone completely before we went into the session yesterday. So they knew that I was still on the fence, that I was really mulling things over, but they didn't know how it would come out. And so they were just, sharing their surprise and, questioning some of the points that I made. And we were just discussing my remarks.
It looked pretty heated, judging from the body language. But I gotta say, do you think you could take Senator Regine Bisco-Lee or what?
That's my friend, and she's a pretty tough cookie. So I don't think it'll ever get to that point.
I mean, but there's no doubt there was definitely some heat exchanged, and I mean that's part of the process, is it not?
Yeah, it is. It is. There was some heat, but it was totally collegial, and there were no harsh feelings, nothing personal. We leave it all on the floor, and it wasn't heated in the way that it might appear on TV. You can only see our body language, but it was a very collegial and professional conversation. I can assure you that.
What was Senator Kelly Marsh Titano? What was she saying?
I don't recall exactly what she said, but I know she was curious about why I chose to go in that direction, and they were kind of just wanting to go through some of the points that I made to understand why I chose that a little better for themselves.
Right.
So were you aware at the time that you made your speech on the floor that this transparency initiative was coming down from Adelup?
Well, I heard that there was a plan. I never saw anything in writing. I never saw a draft or what the plan was specifically, but I was aware that there would be a plan. And so that didn't really, play into my decision. My decision to vote no on the override veto was really because I read over the bill. I reread the bill. I studied it a lot. I studied the governor's veto message, and I just felt that the bill was not accomplishing what we were trying to accomplish. And that's because I don't think that we're able to really legislate the kind of transparency and trust that we were all kind of looking for and hoping for yesterday. So, with that being said, I know the bill was passed yesterday. So right. I hope that is kind of a wake-up call for the administration to say that, people are unhappy. We recognize that people are unhappy, and let's just do better
Yeah.
and work together and move forward.
So what do you say to those people who critics who are going to say, oh, Senator Shelton, she was just going to bat for the administration, because you have to admit that's kind of what it looked like.
Well, if that's what people are saying and that's what people are thinking, I just want to say that I was the one person who voted no out of 15 people, and I honestly voted with my conscience. I looked at that bill and I knew that I couldn't vote yes to an override because it wasn't the measure that we needed. It didn't have the mechanism that was needed, and so
but what changed from 2 weeks ago when you passed it, voted to pass it?
Sure, I grappled with that myself. How would it look if I decided to vote no yesterday based on my yes vote from a few sessions before? And I kept thinking it and reading it over, and I realized that I learned something from the last session when we went in and we were discussing the curfew bill for the governor to be able to have the power during a time of emergency. That was my bill, 335. And, many of my colleagues brought it to my attention that we weren't going to have any enforcement mechanism. There was no penalty attached to the bill. So it really didn't do anything. And, the speaker had her companion legislation for the penalties, which was set aside. And so it would be a bill that I did believe in, but it wouldn't have the teeth and the mechanism necessary to make it work. And that's what I saw in this bill yesterday. I saw, as I was studying it all weekend, and that's the point that just kept blinking at me. And I saw that, and I knew that I learned my lesson in the last one. And being that it was a veto measure, to override a veto, there's no way to go back and to fix a measure on the floor like that. So I just had to vote my conscience and to vote no.
I just got to read some of the comments here. I'm pretty sure you've seen, you can guess what they might be. Future ex-senator on line 2. Glory writes in, she loves the governor. Harvey, from ex-senator to $150,000 a year job at Adelup. In your office, if it ain't personal, come out and face the people of Guam and see how personal they get. Dwayne writes in, but you put religion in that statement. And Andrew, I want to go to that, Senator. Let me just read a couple more of these. I pray for your sake that your supporters see the same thing that you're seeing. So let's just go back. I don't know. This probably is an oversimplification, but when you name drop Santa Maria Comelin, it almost seemed like you were implying that Santa Maria Comelin would not want us to override this veto. So how do you respond to just the use of Santa Maria Comelin? I get what you're trying to do, but people are saying they don't know why you brought that up.
Well, I brought up Santa Maria and Comelin because of the experience that we all just went through this past weekend. I think that was a really moving experience, and the people of Guam felt it, a renewed sense of hope, a renewed sense of faith that we are all longing for. This is a really, really difficult time for everybody. And yes, I understand the suffering that we are all going through, and some out there more than others. And I realize that, and I saw this weekend that we had this visit of Santa Maria to all of our parishes throughout all of the village, and that was a really beautiful thing to see, and it gave me a lot of hope, and it gave me a renewed sense of faith that I want to continue to build on, because I know that we need to have faith in ourselves, faith in our government, and faith in our future, that we're going to get through this, and we have to get through it together. There's no other option for us. These are the elected officials that we have, the governor and the lieutenant governor, us in the legislature. We are the ones here, and we are the ones who need to respond to these issues. And so although I didn't think that Bill 333 was, the right response, it didn't achieve what we were trying to achieve, the everyday transparency that we're looking for. It just can't be legislated in that way. I know that moving forward, the governor and the lieutenant governor, the whole administration sees that we have to do better. And they put out, that EO yesterday, and I'm glad for that as well, because there are all these different measures. And so I hope that we never need to turn to this piece of legislation or wonder what if where is that enforcement mechanism that we need? I hope that we don't need that anymore, because there won't be a question about the trust and the transparency moving forward, that everyone is going to do better.
So do you think Santa Maria Kamalen wants more transparency from the leaders of the world, or do you think she's good?
No, I think Santa Maria Kamalen wants what's best for all of us. And yes, transparency is good, and transparency is needed in everything that we do as government leaders.
Mm-hmm. I don't know. I just feel like, Santa Maria and Kamalen, what happened over the weekend, it wasn't for me about
giving the governor a pass.
Right. It was more just a personal thing for me, that it's going to be okay, that my life is going to be okay, that my family's going to be okay, not that the government is going to be okay, the governor is going to do the right thing, the legislature is going to do the right thing.
I get
so
what
I
you're
think for
saying.
people, it might have been a little offensive that you would use Santa Maria and Kamalen.
You're basically saying,
No,
Senator, that you
that's
got...
just how I feel. I mean, I don't think she has anything to do
Right.
with the legislature or
I don't want to
the
speak for you,
governor or
Senator
whatever.
Shelton, but you were
That's just where
basically
I'm coming from.
saying that you were in your feels because Santa Maria Kamalen, and she gave you that renewed sense of hope that, man, I think that we are just going to get along and everything's going to be...
No, and I don't think that we're just going to get along and everything's going to be fine because we're praying about it. And I didn't mean to offend anybody by sharing my faith with others, but I really believe that we need to turn to God right now, that we need prayer, and that we need the guidance and intercession of Santa Maria Kamalen to lead us through. And that's what I'm talking about. I have the belief that she will guide us in all that we do.
Okay. Andrew writes in, I commend you on standing your ground,
Mm-hmm.
But people are suffering and all elected officials should be for the people. So, anyway. How does this affect your
I believe what I did, and I stood on my ground to say that I am here for the people. And one of, I think, a huge responsibility that we have as legislators is to make good policy, is to be thoughtful and to, make really good policies that we know will work and that we know will get the job done. And so that is what I was doing on the floor yesterday. That's why I voted no, because I know that we can do a better job.
Yeah. Hey, and I remember with the curfew thing, I mean, you called in, you were getting a lot of flack, a lot of heat, a lot of hate. You called in, you stood your ground, you defended yourself against the criticism. What would you say to those people who think that you got something, you're going to get something for your no vote from the administration?
Well, I would just say to them again that I didn't vote no as a favor to anyone. I voted no because I voted with my conscience. And as you can tell, no one else voted along with me. It was just me, and I don't expect to get anything from that. I voted because that's truly how I felt, and I want to show the people of Guam that I will be sincere in all of the work that I do. I will vote with my heart, with my conscience, with what I know is right, and put that sincerity above all else.
Oh, there you go.
No, I'm...
Go ahead, Sabrina.
No, I'm good.
Yeah. Please do, Sabrina.
No, I'm fine. I'm glad you voted the way you did, and
Well, I just
how you feel.
Yeah, I appreciate that you can come in and tell,
stood
and
your
stand by
ground.
it. I mean, I don't agree. I think that we can, and we did legislate transparency. I mean, you're right. We can't legislate trust, but like I said, I appreciate you defending yourself, but I think that the administration brought this on themselves, and anybody who, you don't need a weatherman to know which way the wind blows. And right now the wind is blowing hard for more transparency. And when you were the lone voice to stand up, and whether it's on the technicalities or whatever in the bill, the optics are that you stood up and you don't want any more transparency than is already being given before this bill was. And I know you're smart. Yeah.
I just think at the end of the day, it's embarrassing that we're even having to legislate this.
Yeah.
We're having discussions about transparency, and senators having a problem with getting documents. I mean, Talina Nelson, the vice speaker, she just voted for documents.
It's crazy.
And when
I think, Senator, your comments would have been maybe at the beginning of this, before the administration screwed it all up with the transparency thing. They might have been relevant before, but we're at a point where, like we said, you guys are out of the loop. The mayors are out of the loop. The doctors are out of the loop. The people of Guam are getting... So, obviously, transparency is...
What I said at the beginning of my remarks was that it's absolutely unfortunate that we are, that we had to go into session yesterday and that we had to start all of this with a bill about transparency, that we came to that moment. But what I think happened yesterday and what I think transpired over the last couple of weeks is that, the administration is on notice. They have the clear message that they need to do better. The bill was, the override was overturned. It went forward. And so they know that they need to do better. And, we as co-equal branches of government, there's no way that we can get through this without each other. We need each other to move forward. And so that's what I am committed to doing, to moving forward and to doing whatever we need to support the people of Guam, because we have the same mission. We all have the same goal here in government, and that's to serve the people.
Yeah.
Mm-hmm.
Okay, Senator.
Thank you.
Yeah.
Okay.
Thank you so much.
Take
Yeah.
care. Stay safe.
Let us know, anything you got going on. You got my number. You're always welcome on the show, Senator.
Yeah, I really appreciate that, you guys. Take care, and thanks for continuing to share the info.
Thank you. Wash your hands, okay?
I will. Thank you. Bye-bye.
9:31, Guam's favorite. It's the K-Wave News Takeover containing COVID. Let's go over to the Northern Marianas with Tomas Manglotnia, our K-Wave News correspondent in the CNMI, with the very latest on COVID-19. Good morning, Tomas.
Good morning.
Good morning, Bree and Chris. Here's the latest on containing COVID in the Northern Marianas. Breaking overnight, the CNMI Governor's Office announcing one presumptive positive case of COVID-19 on Saipan. The NMI task force saying that this presumptive positive case was identified as a result of the community-based testing that launched last week. The PUI is a 17-year-old male who presented no symptoms. Further evaluation is being obtained from the U.S. Center for Disease Control and Prevention to make a final case determination. CHCC has already initiated contact tracing. Also last night, receiving word from CHCC Esther Muña, the CEO, saying that the cumulative number of people testing negative from the community-based testing initiative is now 1,476. Again, CHCC Esther Muña, CEO, telling us that the cumulative number for community-based testing initiative is negative 1,476 negative results thus far. Also, more news on the economic front. The CNMI Finance announced approval of the CNMI Stimulus Check Implementation Plan. The NMI Governor's Office writing late last night that this means that the U.S. Treasury will transfer $37.6 million to the CNMI government within the next few days to release stimulus checks to eligible CNMI taxpayers as soon as possible. They say that they're going to release this to all those who are eligible by filing a 2018 or 2019 tax return. Taxpayers are encouraged to visit the Department of Finance website at www.dof.gov.mp to access digital versions of the required tax forms. They also allow questions to be sent through email at info@dof.gov.mp. We also wanted to share the latest numbers from CHCC here in the NMI. The total number of COVID-19 confirmed cases as of May 6 remains at 14, with that one presumptive case. The cumulative number of persons released from quarantine is now 295. The pair of deaths remains at 2, and the cumulative number of recovered cases is 12. And the cumulative number of specimens collected through the community testing initiative is nearing 2,000. That number is now 1,797. And as we reported, the CEO of CHCC, Esther Muñoz, says that 1,476 of those testing results are negative. We also wanted to share that it's worth mentioning that amid increasing calls for transparency from the executive branch and the CNMI governor, the last NMI press conference here on Saipan was on March 30th. Nearly 37 days ago, seems to be a month-long mute of the media. The U.S. Press Freedom Tracker gives the NMI red marks for all of its categories. Those categories are: do they have regular press briefings? They list the NMI as having none. General press attendance? No. Live questions and follow-up? No. Reports of restricted access? Yes. Both Adriana Cotero and I have been reaching out to the CNMI Press Secretary, Kevin Bautista, working on a one-on-one interview with the governor and asking about any press conferences coming up soon. This U.S. Press Freedom Tracker is based on a coalition that shares knowledge about threats to press freedom across the country. They're also part of the Freedom of the Press Foundation advocacy organization that manages day-to-day operations of the site. So, Breen, Chris, as you know, it's been nearly 37 days since we've had a press conference here in the NMI.
Over a month. You know what, Kevin Bautista, you need to do an interview. You're the governor of the CNMI. The people of the CNMI deserve to hear from their governor, not through Facebook, not through Instagram, not through the website, but to talk to the people, because you're talking to the people when you talk to the media.
That's correct, Brian. You know, I'm looking at this spreadsheet of every single U.S. state and territory, and the Northern Mariana Islands is the only one of every single state and territory to have red marks across the board. There's no regular press briefing, there's no general press attendance, there's no live questions and follow-ups, and there are reports, and I've spoken to journalists from every industry here, from every organization here, who say that they've also had some instances of restricted access. So the NMI is the only one in the entire nation right now to have all these 4 marks marked as red in this national report.
Have you received any other update from Kevin Bautista, the spokesperson or press secretary over there, on whether or not he's going to grant you an interview?
Yeah, early this morning, right before I called on the radio, I did receive a message saying that there will be an interview set up with the CNMI governor, Kevin Bautista, telling us that the availability is tough because of all the planning meetings, but they're going to make some time. But of course, we were also told this a week or two ago, Bria. I remember mentioning to you that there were some plans for an interview, but we never got that follow-up from the office. And so we're just waiting to hear. And as Guam just had its conversation about meeting the media, there's lots of media here as well talking about not having the chance to.
You guys haven't even got the chance to get muted. Let me tell you, it's not that you don't want it. You don't want this life, Tomas.
No, I think it's far worse over there that they're not having that access.
No, and I'm making light of it, but it's
the governor there.
Very grave and serious issue.
Mm-hmm. What about the lieutenant governor? The lieutenant governor available over there to talk?
I haven't asked that question yet. I definitely will if his availability is better. But.
And are they taking advantage of the restricted movements that CNMI communities under? For example, if this was a non-COVID time, I know Tomas Maglotnia would be out there sticking his phone camera in the governor's face and rolling hot. But you're not doing that because you're staying home and adhering to these different social isolation and distancing orders, correct?
Yes, and so it's definitely hard because we have to social distance, and that it's difficult if everything is being monitored through email and Zoom, and that's fine. But again, initially when we followed up after the last press conference on March 30th, we were told that they're not having any right now because they're figuring out the technical difficulties. And then the reason became because we're too busy. Well, every single other U.S. state and territory in the nation has, according to this chart, most of them do have daily press briefings. So I just don't know what the case is here. Yeah.
I just got a comment here from Andrew on our Facebook Live feed. Hoffa, I thought we were giving the CNMI kudos for doing a good job. Yeah, okay, I admit I patted the CNMI on the back when they came out with the CARES Act spending plan because they beat us by a few days, so.
Yeah,
but I take it back, okay? I take it back.
No, I mean, credit where credit's due, but Chris, you also know that when you control the narrative and you schedule these videos and schedule these PRs, then over-getting is good news. I've been speaking to some people and want to hear from more of the public next week as, I'm kind of transitioning to covering more of the economic impact. Right. Some people are getting evicted during this time here in Saipan. And we're going to hear about that next week from some folks that I'm reaching out to. So, yeah, when you look at government press releases, more than not, it's going to be the rosy picture sometimes.
Yeah.
Oh, we know about that.
Yeah, and so again, it's just a stark number that the U.S. Press Freedom Tracker is releasing, and again, I'm looking at the graph right now, and out of all the states and territories in the United States, the CNMI is the only one with all 4 marks marked as red.
But you know what, Tomas, that makes the work that you're doing that much more valuable and that much more powerful. So thank you for that.
No problem.
Thank
And
you, Tomas.
I just got here about a month ago from college, but I was also speaking with a bunch of journalists last night, just over Facebook. And a lot of them were saying that even before COVID-19, that chart still applies. And so I trust the journalists who've been here for, over a decade or so, doing this day in and day out, especially. I've also reported here for several years since high school, but a lot of these journalists saying that even before COVID-19, the administration was really difficult to get a hold of. And so we kind of are getting fatigued from relying on press releases and Facebook videos that are, highly produced and elaborate.
I mean, they got music under that. There's like that 80s Top Gun music.
Yeah, and it's something that even when putting news reports together about, COVID-19, I mean, there's this nice background music in the back, and it's kind of distracting.
And I think, we've been giving the kudos to the CNMI government for doing this mass community testing, but at the same time, the results. We'd like to know the results, and I don't even know. We just found out yesterday, right? There was the one presumptive positive. So, I don't even do you get the results every single day as they do the testing?
Right now, the only one that has really given a lot of access to the media, as we've seen, she's offered interviews on the Facebook Live show practically every week, is this hospital CEO, Esther Muña. And she's been very open and publicly available to all of the media, is what I'm hearing, even on my personal experience, giving updates on a daily basis. And again, as I mentioned before, the press secretary is communicating with me on a daily basis, but that's very different from having a live forum or a press conference or a one-on-one interview.
Yeah. So you can get those details.
There's also the fear of being blacklisted. I think we know how that feels to be blacklisted by government as the media.
Yeah. All right, Tomas. Maybe I'll call Mr. Bautista myself and just help you out there and figure out what is going on. Because you're right, the people deserve.
I need to say this more than once, but really, it's not about it's about asking the questions that people are asking, and really, especially with hearing about the evictions taking place right now, I think that those in the community really want some answers about some, from the government.
Yeah, completely understand. Thanks,
now, now Bree's gonna make an angry phone call. I want to hear that.
No,
not angry. When you use your stern voice.
Yeah. Okay. Well, a lot of people are using their stern voice now. We'll see. We hope that they stay true to their word about setting up that interview. We were told about an interview being set up a week or two ago, and we just hope that this time it's they're not teasing the media in this way.
Right. Yeah. Okay, Tomas. Thank you so much.
Thank you so much. Have a good day.
942, Guam's favorite. Let's keep it on the phones, and I want to go to a caller who's asked that we not use her name.
Okay.
And she is actually quarantined at the infamous quarantine hotel, the Pacific Star. And so, ma'am, we just want to get you onto the show. Good morning.
Good morning.
Just tell us, first of all, how did you end up in quarantine at the Pacific Star Hotel?
Well, we flew in from California via Narita, being off island for about 2 months for medical, and also quarantined, self-quarantined while we were in Los Angeles. Returned home, and that's when all the process started. I mean, it was pretty smooth coming in, different checkpoints. And then they bussed us here to the Pacific Star.
How long have you been there?
Well, this is our 1 week so far. Today makes 1 week.
Mm-hmm.
Yeah, it's been frustrating, but everybody thinks that staying at the Pacific Star is luxury, and we're enjoying the life, the view, and all that. But trust me, it's not.
Right.
We want to get home. We want to be able to go outside our backyard, and of course, with social distancing.
Right.
But it's crazy.
How many people are you traveling with?
Well, I have my husband with me, and so it's basically just staying in this room and just not being able to go out. Other than, of course, there's a balcony, but that's it. You know, you can only see so much of that, you know, in a day.
Mm-hmm.
So, but you know, the people here, you know, that we've run into have been our first. I'm not sure how the government got this contract, but Pacific Star needs to be torn down, and just, I mean, it's not as, like I said, luxurious as everybody thinks. Oh, you're at the Pacific Star. It's really run down, I'm telling you.
Well, we heard there were definitely some issues. So do you think it is so run down that it, I mean, did they even pass the code or whatever inspection? Was there an inspection? I don't know.
Well, let me put it to you this way. We arrived Wednesday night from Narita, which was like a 10 o'clock flight at night. You know, like I said, we went through the process, came to the hotel. The people were great, you know, the volunteers or whoever they are, you know, that took care of us.
So, I'm sorry, ma'am, you came in on the 10 o'clock flight, which means you were there probably, around like midnight?
Correct.
So who greeted you at the, when you came into the quarantine facility at Pacific Star?
Well, there were like 3 women that were processing us. One of them was Rebecca and Jack Hattick, and later on in the evening or early morning was Alice Tyrone. So they were really great because we've had issues we went through 4 rooms. And
why? What was the issue?
Well, with our first room, air conditioning was not working. It was musty. You could smell like old dry socks. I mean, that's how bad it was. It was really, the air conditioning, up to now, I have a fan in my room because the air conditioning is just not up to speed, up to par. I mean, you know, at first I thought, okay, we're just due to warm weather, so, you know, but 5 days, 7 days now, the air conditioning is not working properly.
So, ma'am, let me ask you, do you believe the room you are staying in is worth $100 a day?
You know, depending, like if you were in the mainland, of course, you know, because you get a Best Western, you get, you know, and they're up to speed, so that's worth the money. But here, I really don't think so. Chris, let me tell you, the bathroom, the toilet, I mean, it's like calcium line buildup, the faucet in the sink, the handle broke off, the room we were in, the phone line wasn't even working, so if I didn't have a cell phone, how was I going to call, you know, emergency? You know, we can't leave our room, so I mean, I'm just lucky that my husband is a MacGyver, so he was able to take care of the toilet flushing. He was able to take care of, you know, the handle back in the sink.
So Jack Hattick didn't come and fix the toilet for you?
No, what he did do was try to find us another room. So that we went through, like I said, 4 different rooms, and it was the air. You could see the aircon was leaking from one room down to the carpeting. The carpet looked like it hadn't been vacuumed in days, months, and you could really just smell that. I don't know if you know what I'm talking about. It's like that really musty, like that smell that, you know, it just hasn't been aired out or something.
Kind of like my gym socks.
Yeah.
Right. Times 20 maybe.
Yeah, you walk into a gym and it's just really, but you know what? I don't want to come off like, oh, I'm, you know, living the life or whatever.
No, it is what it is. Now I feel like we should feel sorry for Rebecca and Alice and Jack Hattick because, man, they're in the rundown Pacific Star. Everyone's saying like, oh, they get to stay at the hotel. Now it's almost like I almost feel sorry for them. Maybe we should just give them hotel pay extra pay for staying in a crappy hotel.
I mean,
throw them an extra 20%.
And from what I hear, I guess the military people are staying at the Hyatt, or I'm not sure where they're staying at, or whatever. So I'm like, oh, maybe.
Ay, baby, malago Hyatt. Ay, a day. Ay, a day, baby. Ay, a day, malago do Sitani. Ay, a day.
You know what I mean? It's like maybe because they can pay the bill. I don't know.
Yeah, because they got DOD budget. Hello.
Exactly. Yeah. But you know, I mean. Let me tell you, people think that we're living their life because we're quarantined. It really is not. We're residents of Guam. Yeah. We want to go home. Yeah. You know, we've been off island for how long? And, you know, it's just, you know. And then the thing is, they said, oh, you should have gotten that certification from, you know.
The 72-hour.
Yeah. So when we were in L.A. or, you know, California, they weren't giving these tests just to anyone off the street. You
Right.
had to show symptoms.
Correct.
So
So
there
they
was
have
no
the
one
same
to do it.
criteria that we had here.
Exactly.
Yeah.
And so, when we were doing that, it's like, how do you know I didn't catch it on the plane, even though I have the 72 hours,
Yeah.
So who's to say that I'm not carrying it? I got it from somebody on the plane.
Did anybody in your flight have that document, that COVID-free test paper?
You know what? I'm not sure because, first of all, I think there were like only 30 of us, 40 of us on this plane. But everybody was wearing a mask. The flight attendants were wearing a mask. I mean, it was, I didn't get up to go walk around or talk to anybody. I kind of stayed confined, which, I was advised by, my doctors to do that. Just stay put, don't socialize, wear your mask. So we did that. But funny, because we were in customs or, when we were carrying a lug, there are some that weren't wearing masks. So I was like, okay, Guam is not enforcing this mask thing, So I don't know, Maybe they didn't have any. I don't know what the issue was there. But, who's to say I didn't catch it on this plane? Who's to say? So what would the 72-hour letter certification be good for, know? So, I don't know. I just wanted to, put that out there. It's like,
Well, let's put this out there. You talk about you want to go home. We had a call, a gentleman from Talufolfu called in and said he wants to go home too. He misses his 80-year-old dad. So he said, he asked the staff there at the quarantine hotel, why don't you just give us a COVID-19 test? If I'm negative, set me free. If I'm positive, we'll do what we have to do. What have you had any conversation with Alice or Becky or Jack or whichever other directors there making the COVID differential pay? Did you ever ask any of them, hey, can we just get tested and leave, or what's the deal?
That's a good question, because what we did do is they do screen us for any, do you have pre-existing conditions, things like that,
right?
Which I do, so I've answered their questions, and when the nurses come by to take your temperature and all that, they ask all these questions, so I provided them all of that, and I kind of looked at them like, okay, should I ask you what can I do to get out of here, or are you going to say, oh, well, you're a good candidate to be released because you have this, because they did mention, I believe it was Alice that mentioned you can talk to the public health people, they may release you because they've had other people being released.
Right.
But it's like I can't. If I don't know whether it was just the patient or me being released or my family, because I can't be released alone.
You didn't ask for the Tony Babauta special? Because the Tony Babauta special, you don't even need to get tested. You just show up and then, hey, assess me and clear me. Bada boom, bada bing, boom. You're out of here.
Maybe I'm not too high up in the political, realm to
No, all the people should be treated exactly the same. What is good for Tony Babauta should be good for anonymous caller to containing COVID.
But did you ask public health?
I would say that. I would say that. I would be like, you know what, Diablo, you guys let Tony Babauta out without a test. Why can't I get the same treatment? What are they going to do? What are they going to do? What are they going to do?
That's true. How can they answer? No, yes. They'd be, stuck in this, what do I say? Political thing. Yeah.
But did you talk to public health? Did you ask, can you get tested or anything like that so that you could be released?
No, I didn't. I don't want to. That's the thing, Sabrina. I'm trying to go by what they're telling us to do. We're quarantined. This is what you're supposed to do. I don't want to go against the grain. I want to be like every other person, trying to do comply and everything. But, all we're asking is just a decent place to, I've also asked for the hand sanitizer or the wipes because, they're telling you to wipe everything down that you touch, right? Yeah. And I was told that, they have to ask Homeland Security because even they themselves are using soap and water. And I'm like, yeah, but you guys you don't want us to expose you, but you're bringing in bottled water and all these things. We need to wipe that down. We're using our own personal, wipes and everything.
Are you allowed to go? What do you do, if you want to get something from the store? How does that? No, you can't go to the store, or do they have a Tentagu that, does Jack had to go run to the store for you and get your iced coffee, or?
Well, they did make it if we need to get medication or we need to do a grocery run, they can do it. Or you can have family bring stuff in,
Where do they just bring it downstairs and leave it there, or
from what I hear, they drive up. There's a counter or a table that people, come in wearing masks. you just tell them what room number, and then they bring it up shortly after that.
Let me ask you, ma'am, have you heard anything about people being allowed or just having visitors to their room, visitors from outside the facility? Because we're seeing something here in the comments that there's not really, the security isn't what you think it would be.
You know, Chris, I have not seen anything. I'm one of those really law-abiding citizens. I stay in my room. I don't go out.
You won't even ask for the Tony Bavazza special. That's how law-abiding you are.
I mean, I don't want to go out the door and say, man, we're going to start the 14 days all over again, you know?
Yeah.
So I'm like, no, I'll stay in my room, and believe me, like I said, everybody's been really good. I mean, we don't ask for much. We just want the basic necessities where can we have the air conditioning running, where we're not perspiring in a room that's
I would say a room without aircon, definitely not worth $100. I'm thinking like 40 maybe.
Yeah. And like I said,
how's the food?
Yeah, how's the food?
Oh my God! I've never appreciated warm meals. It comes very cold. You have bacon that seems like it was fried 4 in. You've got it's packaged and everything wrapped in saran wrap or so. But when you open it, it's cold. It's just really cold meals. And I'm always telling my family, my husband, there are kids that are starving because I'm tired of
there's starving kids in Mong Mong.
Yeah, or I just appreciate it, and I thank God that we have somebody who can bring us food. I think we've ordered food to be delivered outside because it's just not palatable. I mean, you've got like a pasta with some other dish that just doesn't jive. But you know what, I'm just, like I said, I'm surviving. We're all surviving. I just cannot. I think I asked one of the girls, I don't know whether it was Rebecca or Alice or something, and they said, you know what, we can put up with a lot, but not with the air conditioning. So they did go out of their way to try to find a room that the air conditioning was working, but they were all the same. And she goes, I'm going to tell the manager. And up to now, it's still not working. I mean, I think it's down to like 80 degrees, 75 degrees in here, and we have a fan running. So what does that tell you,
Tells me that the government of Guam got a crappy deal.
Chris, honestly, I really think they did. I mean, I don't know what it's like at Days Inn or whatever, but I would go there if the air conditioning was working. That's all I want. I mean, you're in Guam, for goodness sakes, it reaches up to the 890 on,
Yeah.
Come on,
I'm speechless. I don't know what to say.
Yeah, I mean, you can open the sliding door here, but you're outside and the patio's hot or the balcony's hot, So, and then I've got screws coming off of the sliding door, so we had to screw that back in.
Is there anything that's okay?
What's working?
Yeah.
Start there.
The TV.
Oh, okay.
One room, would you believe, Chris, one room had an antiquated TV. I mean, we looked at it like, what?
That must be the kind of TV my grandma used as a table.
Exactly, for real, yeah. But like I said, the beds are okay. They always ask us if we.
Who negotiated this? Who negotiated the use of Pacific Star as a quarantine facility? Whoever did that, they need to be held accountable.
No,
it's a crappy deal. The rooms are not worth $100.
And I'm wondering, is this what they give our tourists, or is it just the locals because we're dumb? I mean, I don't know. Is this what the tourists see when they come in? I mean, Chris, you can step on the carpeting and you can feel that it's musty. It's really just not. I mean, I could take pictures and send it to you.
Good, yes.
Do you have allergies? Because I know that my allergies would be on fire, and then I would be able to get tested.
Yeah.
Yes, Sabrina, I have asthma, and so
oh my
when you know those things, it's a trigger, and so I'm like, okay, I carry like my nebulizer and things like that. So I'm like, oh, okay,
You know what?
And they won't let you get tested?
Why don't you just tell them? We told this to the guy from Talafofo. Just tell them that you have lost your sense of smell because the room stinks. I bet you wish you lost your sense of smell.
Yeah, I mean, sometimes I'm like, but the thing is, where are they going to put me then? Do I just go home? Or do I stay here longer?
Well, you tell your family, we're all going to say we lost our sense of taste, we lost our sense of smell, and then you have to let them know you're not a dummy. You know the symptoms for COVID. I know my rights. I know that I have the symptoms. I demand to get tested. And then let us know how that goes.
Okay, I will.
Thank you.
In fact, they're going to do their 1030 check. So,
Right.
You know,
And let me know. And then can you send me some
Send
pictures?
pictures, yes.
Please, yeah, video.
I'll send you pictures of our
Shoot
room.
sideways,
I mean,
though,
we're probably
okay?
going to get treated crappy now, but...
No, they
No,
won't.
we
got
don't
you.
even know who we're talking to.
Yeah, you're anonymous.
Okay.
Make sure you shoot it sideways, though, okay? Anonymous lady.
Okay,
Thank you. Okay.
Take care.
Yeah, bye-bye.
Okay, bye-bye.
Oh, there you go.
Oh
Wash your
my
hands if this thing's working. Like, whoever negotiated this, and they didn't even go in these rooms and check anything out. I wonder if there was ever a site visit. But again, I want to just
What are
say,
the other hotels again?
Days Inn, Wyndham Garden. There was Santa Fe for a little bit. There was also Perlis Court.
That's not a hotel.
That's not. It's a yeah. Hey,
we should ask Mary Rose about that.
We
Like,
should.
did you negotiate or present this to Perlis Court?
no. I asked her about that. She said Perlis Court is not a member
Of
the Guam
GHRA?
Hotel Restaurant
Okay.
Association. So when Adelup comes out and says, "Hey, we work with GHRA," they might have worked with GHRA for those Pacific Star, Wyndham, Santa Fe, but not Perlis Court. Perlis Court is just off on its own, which begs the question: how did they even know that they could ask to get paid? I don't know. But hey, it's 10 a.m. We're going to end on a good note here. Sabrina, we are going to end on a good note if it's the last thing we do.
All right.
Okay?
Yeah.
I want to bring Crystal onto the show here. Crystal, good morning.
Hi, good morning.
Hi, Crystal.
Now, let me tell you a little bit about what Crystal did. Crystal makes cookies.
Did she make the cookies?
She made the cookies.
You
yeah.
made the cookies yesterday?
Yes, ma'am.
Oh my gosh, they were so good. The fruity pebbles, and then was the chocolate ones. Is that cocoa pebbles?
Yes.
Oh,
Right.
So delicious.
So, Crystal, can you just tell us, how did you get this great idea to bake, hundreds of cookies and to give them out to people who are on the front lines of fighting this COVID-19?
Okay, well, I initially wanted to just show appreciation for frontline workers and all essential workers that are continuing to provide services during the quarantine. And I started doing it by donating to GMH graveyard shifts because they were getting money donations, but not for graveyards. So it started with that, and then I just decided to do small agencies or small businesses that were not really getting donations from like bigger businesses. So that's how I started doing it. And I did it throughout the month of April.
Right. That's awesome. And I think it's kind of cool that you did it throughout the month of April, but we're only finding out about it now.
Mm-hmm.
Yeah, because of the Giving Tuesday initiative.
Right. And so you kind of went public on Giving Tuesday, but I think that's cool. You did it for April, and it wasn't like, hey, look at me, I'm doing all this stuff, which is how people usually do. It's social media. It is what it is. But how did it make you feel, Crystal, to go around and it's pretty awesome.
And the fact that you went to the graveyard shift.
Yeah.
Yeah. Well, it's just rewarding, and it was just basically to show a little appreciation for, people that are continuing to provide service. And I'm not new to giving. I always donate to you guys' toy initiative.
That's right. You look very familiar.
Yeah. So, yeah, I'm not new to giving back. Just probably the first time it's going public.
Right.
Is there a story, though, that you'd like to share that, when you were delivering these cookies, is there somebody that maybe, or a group of people that you may have met that really got you, I don't know, kind of...
Maybe the cashiers at Koshila.
Mm-hmm.
Actually, they were really surprised and really appreciative. And also the Port Authority,
mm-hmm.
many of the employees there were really grateful. And in general, everyone that I have delivered to, they would send me a message, saying a thank you, and we really appreciate it.
Cookies bring so much joy into people's lives.
I know it made me happy.
So when you went to these places, because we got a donation yesterday, ice cream, and I'm in my mind, I was like, hey, no way. What?
Mm-hmm.
You're going to give me... So was there ever that reaction when you got down to deliver these cookies? You're like, hey, I just want to give you guys these cookies. What was the reaction that people had?
Yeah, some were shocked. Some were like, why are you giving us cookies? And I'm like, it's just to say thank you. Thank you for everything that you do.
Oh.
Well, thank you. You might want to deliver some over to Pacific Star if you're making. So this is just awesome. You made these cookies, and girl, I make cookies. Making cookies ain't cheap, okay?
Mm-hmm. Yes, and it's a lot of work.
Especially if you're putting Fruity Pebbles and Cocoa Pebbles and all the other stuff. I mean, I'm just on chocolate chip.
Yeah.
So we wanted to just bring you on here and share this great work that you're doing with our audience, and just kind of share all the different people that you've delivered cookies to. And also, we wanted to get in good with you so that when your next batch of cookies, you know, if you happen to swing by 600 Harmon Loop Road, you know, no one would get mad.
Yeah. Okay.
All right, so Crystal.
Hint.
Yeah.
Thank you.
Thank you so much.
Thanks
and
a
we
lot.
just want to tell you that you are a COVID hero.
Thank you.
There you go. Cookie Crystal.
Thank you.
Take care. Take
Good.
care.
God
Thank you
bless
so
you.
much.
Wash your hands.
Okay.
Okay,
bye.
bye.
Okay, bye.
That is just so, touch my heart.
Oh.
Yeah.
Touch my heart. Touch your heart.
It's
Touch
a big
my
heart.
Yeah.
So we always
They
try.
really were.
Yeah.
They really were good.
Yeah.
And I I like cookies. I bake a little bit, but I don't really make cookies. But I tried Fruity Pebble cookies before, and these were pretty good.
Yeah, they were definitely elevated. I want to say bedazzled. She's doing bedazzled cookies. Hey guys. Just want to thank you so much for listening today, of course, on the radio, 93.9 FM in Hagatna, Guam. We're Guam's favorite on the KUAM News app, KUAM.com. Again, the Docomo stream audio on Channel 10. And KUAM TV 11, we always dump the back half of the show out on the TV for you guys, and we know that it's the morning show of choice at Hotel Quarantine Pacific Star, where the aircon blows hot. And Jack Hattig,
where the food is cold.
Jack Hattig will fix your sink for you. All right, so it's 10:06. My name is Chris. Sabrina, great job today, as always.
Great job to you, Joe, sir. Good job, Joe.
Yep, and Ken Sanity, also a great job, but most especially to all of our frontliners, thank you so much for the work that you do, and to our listeners.
Joe, what?
Yeah, to our listeners, our commenters. Yeah, thank you guys so much.
Guys.
Bree's like, okay, let's get out of here.
No,
I'm just trying to get your song.
We do have some work to do.
We do, yeah. We don't know if there's going to be a press conference today. We did ask the acting chief of staff, John Jr. Calvo. He wasn't really clear on it.
Yeah, I mean, that was a long press conference yesterday.
Right.
They did extend it because we asked that, instead of the one-on-one, we're already here. Let's go ahead and just get our questions. And so they accommodated the media, and there was a lot of information that came from that, and some information that didn't, but but they did extend the time with the governor, and we were really appreciative of that. So
definitely, yeah, and I think it was I could tell just by watching her and judging how she's done in the past press conferences. I think that with the announcement and implementation of her local aid program, I feel like the governor has a weight lifted off of her shoulders, because there was so much pressure on her, and you could tell that she was responding and speaking with, it seemed to me like renewed vigor. So that was refreshing.
Right, and so again, she signed the executive order that established the Procurement Celebrity Student Itautal.
Yeah.
Sorry, I can't remember the whole thing, but it is a local disaster aid relief program, and the first set of checks, as I understand, is going to be cut on Friday, and then you can apply at Public Health's website. If you are in the SNAP and is it Medicaid?
Yeah, you're already eligible.
Right.
Or
already in the program, you should be getting a check. It's anywhere between $300, but the cap is at $1,200.
Right.
And it's a total of, I think, 18,000 residents.
Right. And so we're going to get Ricky Hernandez from GITA before the end of the week to kind of go into the aid program that they have for the small businesses.
Right, and also maybe even talk a little bit more about as we navigate toward PCOR 2.
Right. Okay, so it's 10:09. Wow, 9 minutes overtime.
Uh-oh.
We're getting our COVID differential sliding scale thingamabob?
Would we be Category 1?
I don't
category
know.
2?
I think we're Category 1.
I don't know.
Sabrina.
I'd like the double pay.
You're doing a great job. Okay, so for Sabrina, my name is Chris. Thank you guys so much. This has been Containing COVID, the KUAM News Takeover, Guam's favorite 994. Esta. Adios!